Good evening, everyone. Welcome to tonight's meeting with the Children's Services Education Skills Committee on Thursday, the 20th of November. There are no planned fire drills during this meeting. If you do hear the fire alarm, please treat it as a real emergency and evacuate the building via the nearest safe escape route. The nearest safe escape route is via the stairs to the left as you leave the chamber. Now in the public gallery. Exit via the door at the back of the building, walk across the inner car park to the evacuation point, which is the pavement opposite the police station. The lifts cannot be used in the event of an emergency. Please do not re-enter the building until you're advised to do it safe by a member of staff. Thank you for that. Welcome to officers, guests who will come clear in a minute, press and councillors. Apologies. Councillor Lilly has apologised. Councillor Fuller is in the building somewhere, I believe.
Right. Councillor Fuller is going to be late. He has a family emergency to deal with.
Okay. Thank you. Councillor Hendry said he was trying to get here as close to 5 as possible. Councillor Mosdell kindly is filling in for Councillor Love, who's on holiday. I think that's it. So we are quorate. Before I proceed any further, Simon Deere, who many of you know, has sadly passed away. So I think we could just like to have a minute to remember Simon Deere, who's Vanessa, were you aware of that, Vanessa? Okay, so just just putting a minute. So Simon was a member of this council for many years. Did lots of things good for children's services. I know he retired through ill health, but I was quite shocked when I heard actually, because I worked quite closely with Simon as cabinet member, so he'll be dearly missed and remembered by all of us. So I believe his funeral, in fact, was yesterday. So yeah, sad when someone passes away, but Simon will be greatly remembered for what he did for children's services on the island. Thank you. Okay, we come on to item 2, which is the minutes of our meeting on the 2nd of October. Have any comments from councillors regarding the accuracy of the minutes of the 2nd of October? Okay, kind of a proposer for the minutes, please. Councillor Andre, the seconder. Councillor Critchton. Those in favour of passing those minutes, please show. Thank you. Councillor Mosdell, you're abstaining, I assume. Okay, that unanimously passed. I'll just. Thank you. Okay. Item 3, declaration of interest. Are there any declarations of interest that council need to declare not already on their declaration of interest on the council's website? Councillor Andre.
It is actually on my record, but just for purposes of clarity, I am a member of the Youth Justice Management Board. Try to get that out. And there are several of us here that are standing members of the Corporate Parenting Board.
The Parenting and Partnership Board. Sorry, that's it. Okay, thanks, Debbie. Anyone else? Okay. There are no public questions in advance. There's no members of the public, so we'll assume there's no public questions. So item 5, members' questions. There are no written members' questions. Are there any specific members' questions? Councillor Critchton.
Thank you, Chair. I've got a question from Councillor Jones-Evans who'd like me to bring along and ask the team. So I will just get that here. So she says that November is Care Leavers Month, and the LGA published a report in September, the guidance on improving opportunities for physical activity for care experienced children and young people. There are 10 recommendations to help support this vital pathway for health, confidence and general well-being for our care experienced children and young people. What are we as the Isle of Wight Council already doing, and what can we do further to support the recommendations? I won't list out those 10 things, but I'm sure you're aware of them. So thank you.
Do we want to give a written response as she's not here, or do you want to give a verbal response? What would you prefer to do?
I can give a quick verbal response for some of that. If there's bits missing, I'm more than happy to follow up with something written.
Thanks, Mark. Go ahead.
Okay. So currently for our care experience young people, there's a number of different ways that we support them with physical activities. The main one is that we can provide a gold card, reduced membership through the Isle of Wight local council. We will purchase that for young people. We review that every 3 months, and if it's being used and they're using it appropriately and getting use of it, then we will renew that for them. The other way that we support physical activity is through their pathway planning. So all young people have a pathway plan, and similarly, we will look to see what physical activities they want to do, because actually we also know there's a really good correlation between good mental health, physical activities, as well as feeling fit and healthy eating and things. So the pathway plan, I could probably give you some examples. It'd probably be easier where we've had young people that have had certain interests in sports, and we've either helped them with subscriptions to sports clubs where they can't, or get subsidies. Similarly, we've also helped young people to purchase equipment to participate in the sports of their choice. I think I should also say as well, we have some care experience young people that live off the island, and similarly we will look for opportunities for those as well with local gyms and local authorities about providing the same opportunities for our own children here. With regards other opportunities, my agenda item later around the parenting, the strategy that the priority 2 is about well-being and fitness of our young people. And through the Parenting and Partnership Board, we have identified a elected member as well to look at the action plan, to look at further opportunities and increase the offer for our care experience young people. So we've got some other opportunities done, but I do think that buy-in from elected members is really important to find opportunities across the whole of council for our children and young people.
Thank you. Can I just add to that? I know when we spoke to some young people before, it was the getting access to it and getting there really was part of the problem. That if they didn't have buses, getting people to pick them up, not their guardians weren't always able to give them those opportunities, and I think that was really good to make sure as many barriers are brought down as possible, because it is difficult for them to take part in activities that their friends are going off to do things but they can't. So no,
we quite agree. It can be expensive as we know on buses, where we have helped sometimes with bus tickets and things for young people, where we feel it's really important. But you are right, you do identify another problem. I think for some of our young people, it's really expensive to move around the island, but we can subsidise where we can, and we have on it's kind of young person basis. We have helped where we need to, and that there's a real need to.
So they don't all have bus passes?
No, they don't.
Is that something we can look into? Yeah. No, I think that's some things that as members we can help feed into that.
We welcome that.
Yeah,
very much
really
welcome.
good. Thank you.
Yeah, do you have enough to feed back to Julie in answer to a question? Mark, thank you. Are there any other members' questions? Okay, we'll move on to item 6. And I'm grateful that Anthony's here this evening. The reason Anthony's here this evening is that, as you know, on the 11th of September, I sent a letter to the ICB raising concerns we had specifically around speech and language, school nursing, etc., 5 key issues. We got 3 pages of waffle back from the ICB. So what we agreed at the meeting was that I would write another letter to the ICB asking them to actually answer the questions that we asked in the first place, rather than 3 pages of waffle. But I had a chance of a meeting with Anthony, and Anthony said, well, I can answer those 5 questions for you, which is why Anthony's here this evening. We have not got a scrutiny function, so we can ask questions without scrutinising. I'll leave it there. But I thought it was easier if Anthony come and answer the questions and talks about things we asked about. What is happening in the ICB would be easier than another paper trail of letters. So, and Anthony's seen the original letter that I sent to the ICB and the response we have. So Anthony's great. I'm grateful Anthony's come to answer those questions directly to you, and I will allow a certain amount of questioning without being scrutinising at the end.
Thank you, and thank you for your invite to respond to those. I haven't prepared anything particular, and I'm really happy to respond to questions that the committee has. I wonder if I just clarify some of the letter. As Councillor Brading says, he was really clear with us that we were a little bit corporate in our response and perhaps not as clear as we might have been. I think it's important just to outline some of the progress that the ICB has made and some of the things that the NHS have done well for children and young people on the island, particularly around our CAMS and our MHST performance. I think Councillor Brading had a question about the numbers that were on the front of that letter, and just wanted to clarify that they were island specific. So it's very clear that the island, in many instances with NHS Services for Children, does better than the mainland. The wait lists and the access times are much better for children in the majority of services on the island. And I thought that was important just to reflect back before looking into some of the further challenges. There were 5 challenges that had been raised by the committee. The first one around speech and language therapy. We're very aware that the historic structure where the council funds speech and language therapy service is not the strongest way in which we can deliver those services, and there are some limitations on what the council service is currently offering. We're also aware that it's putting an undue pressure on the dedicated schools grant funding services which should sit within the NHS. We have allocated funding within this year's planning to allow us to transfer the service from the local authority into our community health provider. Unfortunately, we've not been able to progress that as quickly as we would have liked. The due diligence of our provider has meant that we've not been able to transfer over the staff and the work, and there continues to be discussion and debate predominantly around case loading. So the challenge is the difference between what the team currently do that is NHS work and what the team currently do that would remain local authority work. And there's continuing discussion between the local authority, the provider and the ICB about that. In order to offset the spend, what we have agreed with the director is that the ICB will fund the 4 posts that we've asserted that we would transfer over for this year. So they remain within the council structure, and the council continue to deliver the service that they were delivering, but we will offset the funding of that commensurate with what we hope to transfer. It isn't an ideal position. It is a position that is reliant on our community provider transferring services over, which isn't something we can mandate them to do. But we hope that the interim arrangement, financial offset, will go some way towards supporting the local authority as we try and move to a better system and structure. And that said, children are accessing speech and language therapy assessments, and the gap is relatively small. It is a gap, and we do acknowledge that that needs to be kind of picked up and dealt with a little bit faster. Are there any questions particularly on that?
Councillor Andre.
I'd really like to understand how the pathway is going to be affected for parents and children that want to access the service, because obviously there's a lot of changes. It seems we're sort of currently in a transition. So how will that actually affect access and the pathway?
So the pathway wouldn't change. EHCP assessment and intervention would remain the same pathway we currently have. It would just be picked up by NHS staff rather than by local authority staff. So we wouldn't see any substantive difference in that. We are just in the process of mobilising a new therapy service across Hampshire and the Isle of Wight, which is much more focused on our early intervention. What we need to do is bring down the number of children that require access to specialist services as a result of being picked up very late in their journey. That is already being mobilised, and we hope to see an impact of that in the coming year. So fewer children should need those specialist interventions by the time they're arriving at school, and we're doing much more with our early years. We have been fortunate to have some national funding delivering a pilot in Portsmouth around early language for every child, and that's been really successful, and we're hoping as part of our planning that that can roll forward across the ICB in some of our target areas from April. So part of what we want to do is to reduce demand. So part of the pathway change needs to be around that much earlier intervention. So some of the wait lists and delays for EHCPs around speech and language therapy, the intent is, if we get it right, that demand won't be there in the first place. So that should reduce the demand. So the pathway shouldn't fundamentally change for those children with EHCPs. What it will do is open it more broadly for children who don't have an EHCP but do clearly have some speech and language challenges.
Can I just say that's really good to hear, because the language that you're using is exactly the kind of policy that we've got, is early intervention to prevent escalation. So it's really good that we seem to be on the same page here. Thank you.
Further? Yeah, Ashley, of course you can. Sorry, I need to look to my right. Sorry.
Can I just say, Anthony, thank you very much. Just for clarity, in case there's any council staff listening to this or reading the minutes, that there have not yet been any discussions with council staff formally about any transfer to the NHS, for example. And at the moment, I think things are working okay, because essentially the local authority colleagues who are sitting within our team are carrying on doing the work they've been doing for years. But the difference this financial year is that the Integrated Care Board are reimbursing the council for the cost of that. So I guess the next question is going to be about, well, what happens next financial year? You know, we're not that far away from it. Given that how long it takes, I think we'd be hard pushed to do anything before the end of this financial year in terms of staff transfer or anything like that. I think for families, children, young people and parents, they don't really care whether people work for the NHS or they work for the council. What they want is the pathway to be the same. We've heard about how, from their perspective, it shouldn't make any difference who someone works for.
Thank you. Yeah. Do you have any more questions?
So the second point was with regard to special school nursing. So the nursing provision that we have on special school sites and the inadequacy of the current provision. We currently fund healthcare provision on the site of 2 special schools. At the moment, it is proportionally the best funded healthcare provision we have across Hampshire and the Isle of Wight per head of pupil. Unfortunately, it is subject to the recruitment and retention challenges that we see across a lot of children's services. So the provider has struggled in order to underpin that. We are assured by the provider that the provision is safe and adequate in meeting needs, and we have raised that several times with them, and must trust that the provider is able to give us that level of assurance. We have done a system review to look at developing a joint protocol for managing healthcare needs, so that we can kind of overcome lots of the difficulties between health and education and the way in which we fund and approach the support for that. That process has been very complicated and has taken us much longer than we'd anticipated. The intention is to do that across all 4 local authority areas. So those conversations have been much more complicated than we expected. The protocol is currently being reviewed by ICB and local authority solicitors in Hampshire. And once we've got through that process, we're really confident that schools will be brought into working with us on that. That will be much clearer around DSG responsibilities, NHS responsibilities, and how health and schools can work together much closer to deliver that for children and young people. So it's taken longer than we'd anticipated, but it is certainly a step ahead of most other ICB areas. So whilst today it's not as good as it should be, we're really confident that the plans that we have in place will really drive us forward. Both St George's and Medina have been involved in discussions around the protocol and are really happy with the position that we have kind of come to. So I'm hoping that that will provide the committee with the kind of the assurance you need going forward, acknowledging that today isn't as strong and robust as it could be.
Questions?
So initial health reviews and review health assessments for children who are looked after by the local authority. Some concerns about time and pace of those and the accuracy of them. We have asked the community providers designate nurse to do a review for us on the island. She doesn't work on the island currently and doesn't cover that, so it gave us an independent view of what was happening. There are some internal issues around admin and the way in which the processes are managed, but she has provided assurance that the process that is working is timely and is accurate. There are some staffing challenges and have been as a result of some long-term sickness. We have dealt with those, and there is now an interim service lead nurse managing that team, and we've managed to underpin the bank staff that we were using. I'm assured that the staff were working at full pace and were delivering a good quality service for the staffing that we had. The data that we have from the team is that they are responding in a timely way once the notifications are received. That obviously doesn't coincide particularly well with the local authorities data. And Kay and I have spoken about looking at bringing together the two data sets so that we have one version of the truth, so that we can follow and track when children come into care and when we're responding. We have had exactly the same challenges in both Portsmouth and in Southampton, and the issue has been the way in which data is recorded in the two separate places. A joint admin post in both of the cities has resolved that, and we've seen a significant increase in compliance rates, not because we got better at anything, but because we recorded more effectively the work that we were doing. So we're just reviewing with our provider how we might find resource for that admin post, relatively inexpensive and fairly simple to put in place. But at the moment, given the NHS position and headcount requirements, it's not quite as easy as it looks like it should be. But we're hopeful that that will come into place. So the health element of what we have, we're confident is delivering what it needs to in the way that it needs to do. We will, in the coming months, move that from the Islands Healthcare Trust into the Community Trust alongside the rest of the children looked after health provision that we have. So the island provision stands aside from everything else we deliver on the mainland, and we're looking to rectify that as soon as we can resolve some issues around transfer.
Councillor Andre.
Just one question, it's slightly more general nature. We're hearing of more and more things being transferred to the Community Trust, and we know that they are effectively still rather at the beginning of their journey. But how can we ensure that they have the capacity and the resource to actually deliver the outcomes that we're looking for?
So one of the key benefits of moving a lot of our community services, particularly from the island into the main trust, is that it provides much more sustainability and resilience. The teams become much larger and much more able to flex their staffing resource around. With the use of more modern technologies and a lot of video appointmenting, it means that we can respond much more quickly from the mainland to a lot of appointments that at the moment we're not responding as quickly as we might want to on the islands. The reason the Children Looked After service didn't move is because it was kind of missed in the fusion transfer. So it's something that should have moved, but hadn't been seen because of the way in which the trust was structured in its acute and community divisions. So it's kind of a later thing that's coming along, but something that probably should always have happened. But we're confident that being part of the bigger system will allow much more sustainability of what we're offering.
Councillor, add that border on scrutiny. I'll let that one go. How can we, as opposed to can we be assured? How can we be assured? But anyway, I'll let that one go.
Thank you. The medical advisor role for adoption has been a particularly challenging issue for us to resolve, and I'm aware that it has put social care colleagues in very difficult positions. The provision has been delivered by the Isle of Wight Trust for a number of decades, I believe, by the same consultant, which meant that we had a really good firm system. Unfortunately, what it also meant is lots of things were happening as a result of individual officers in individual places rather than as a systemic process. What that means is when Dr. Galate stopped doing that role, there were a whole load of issues that we hadn't really noticed or seen. We also have some challenges around finances and funding and where they sit within the trust. And the control that the ICB have over moving some of those. The intention is for us to have a single adoption medical advisor structure across Hampshire and the Isle of Wight. It isn't sustainable at the moment, and we have 4 different models. So each local authority area has a different model. We had agreed an interim arrangement for the island with an organisation called TriCare in the mainland, who manage a lot of the initial and review health assessments for children coming into care of Hampshire County Council. That hasn't worked as quickly or as robustly as we'd have liked. There are some challenges around supervision and training for the medical assessor that's come in to role. The provision is there, but we are not connecting him as well as we should do with that. I am fully aware of the challenges that that's caused Kay, and Kay has escalated on numerous times with us to try and get us to kind of move forward with that. I can only apologise that we're not delivering in the way that we need to, and we are working as hard as we can to try and resolve some of those issues. Funding hasn't been the problem, finding somebody has been. So our core community trust aren't able to respond and provide any additional resource. We don't have independent agencies that are able to provide that resource either. So it's been a bit difficult for us to find that within the system. Alongside that, we do also need to review the accountability for the medical advisor's role, and we've issued a letter to all 4 local authorities to start a conversation about where the responsibility for the funding and commissioning of that comes from. And I'm aware that there's a debate for us to have around how we kind of move forward with that, and the 4 local authorities have some questions and some thoughts to put back to us.
Councillor Mosdale.
Chair, I want you to frame this, please, because I'm very good at asking scrutiny questions, but not very good at asking questions that aren't scrutiny questions. Where does this actually, in layman's terms, leave us with the children that need to move forward, and that are we stuck, and are those children stuck in the wrong places, not going to the right places because this part of the link is missing? How do we? You can ask that.
That is a non-scrutiny question because you're not challenging what they're doing, you're asking how they're going to do it. So I think that's fair for Kay or for Anthony to answer. Yeah.
Thank you, Anthony, because I think it's really helpful that you've given the overview of the situation and some of the difficulties. As we speak today, we still have some issues about delivering the medical advisor role. Some of those issues are systems issues, so we're not able to provide the medical advisor with the information that he requires to fulfil that role. Some of those issues are around which departments within the 2 health trusts are able to provide what's required. So as we speak today, it has had an impact on the timeliness for adoption decisions for 2 children. And we have 3 children who require decisions to be made within certain timeframes within the next month, so that we can put forward final evidence within court. So it is having some impact on individual children at the moment. Auntie and I met and spoke again yesterday to try to explore how we can unblock some of those issues. And certainly Anthony's agreed to go away again and speak to some of our colleagues in the different departments that are responsible. So I'm hopeful that we'll be able to resolve those issues so it doesn't impact those 3 children within the next few weeks. But I don't have a guarantee as of today, unless Anthony's got an update on that.
Don't have a further update from the conversation we had yesterday.
Yes, Councillor Mosdale.
Sorry, so when will this committee know that those children, because the most important thing is that the best interests of those children are being dealt with, and any type of bureaucracy is cut through to try and sort that out. So I think the original question for me was the letter that I was on this committee at that time that was saying, when can this be sorted? At the moment, we don't have a definitive date when. How can we ensure that this committee chair is kept informed, whether it's an email or something, because this is something I really do feel that, you know, we need to keep an eye on, a really close eye on as a committee. So through the chair, I'm not sure how you'd like that resolved.
I couldn't agree more. That was the last bit. Yeah, and how will we know? Yeah.
Absolutely. I'm happy to provide a written update, perhaps through Ashley, to the committee on a regular basis to make sure you're able to check and monitor the progress that we're making. I'm not able to provide a deadline date currently, so I think that's probably the most effective way that we can keep that kind of monitoring going without scrutinising.
Yeah, lots of nods from Kay and Ashley saying it's fair. Councillor Andre.
Sorry, just if I'm allowed, Chair, further question. So I sit on adoption panel. Have Adopt South been included in the conversation? Because there may be, I know that you know, on adoption panels we've had issues with medical advisors, but
so Adopt South, the interface with Adopt South is through our designate safeguarding nurse team. They regularly attend those meetings and they have the information that we have. We update them prior to that. So I would be hopeful that Adopt South are fully appraised of where we're up to. If there's some feedback that that isn't the case, I'm happy to raise it with our designates.
Okay.
So Adopt South at the moment have a contract for us where they provide our agency decision-making element for should be placed for adoption decisions. So they're fully aware of the situation, because in order for Adopt South to do the agency decision-making, they require medical advisor sign off and information. So they're kept up to date on the system position, but also on the impact for any individual children. So they're fully aware of where we're at.
Thank you. Have we covered all the points on the letter we have? Is it?
Sorry, I think there was just one around initial child protection conferences. And again, Kay and I spoke about this yesterday morning. There's a national issue with the timeliness and quoracy of initial child protection conferences, largely driven by the withdrawal of public health nursing from being the kind of the default health person that attends that. It's a national issue as the public health purse has declined and the number of health visitors and school nurses has declined. They have moved away from what has been custom and practice in the past, rightfully so, to focus on their core work and their core functions. What that means is that we've had a knock-on effect into initial child protection conferences. A huge amount of work has been done across Hampshire and the Isle of Wight to review that. What we have kind of figured is it's a really complicated health system. It's not possible to commission a single team that would provide that function, because it means that you wouldn't have anybody attending those conferences that knew and understood the child or their background. It would also be prohibitively expensive when it was modelled and looked through. What we have done is we have been piloting with Hampshire the use of some admin resource within the MASH function, so that once the MASH decision has been made and a requirement for the ICPC at the initial child protection conference has been put in place, that admin resource is able to coordinate appropriate invitations to the health system being numerous different organisations across the island. We're just looking at whether we can find a way of providing that same admin function into the MASH here, and we're currently talking with our community provider. What that will do is allow us, rather than relying on a social worker to make decisions about health colleagues and who isn't appropriate, that can be done through health decision making within the MASH. And there is a review of our total MASH resource currently, and there is some more money that's been assigned into MASH. We're just negotiating what that full structure looks like with the provider. So again, we're not there, but I believe we have a plan and it has been tested elsewhere. And I'm hopeful if we can find the resource that will resolve that issue around quoracy.
I see no more questions. Firstly, Anthony, thank you. I think if that response has come back to the letter.
Sorry, if I may just interrupt. I think there was one other question that you posed about the neurodivergent pathway transformation.
Apologies. I asked for a reminder, what was the overall focus of that question? It was the full pathway, I believe.
Sorry. It's about an acknowledgement that services for neurodivergent children across the system fall short, and that addressing it requires whole system change and a commitment to working with partners to deliver transformation. It's just, that was the sort of more corporate response. So where are we on the ground as we speak with that transformation?
Absolutely. So the ICB have been working with colleagues across the system, all 4 local authorities, voluntary community sector, to change the whole of our neurodivergent pathway support. At the moment, it's very focused on formal assessment, and access to a lot of support functions for children and young people are reliant on diagnostics, which are taking a really long time and mean that children and young people aren't accessing support to enable them to do basic things like being able to go to school. The pathway transformation is based on trial work that's been done in Portsmouth over the last 2 or 3 years, and is also being rolled out nationally. There are lots of ICB footprints that are following a similar process. It focuses very much on early identification of need and response to supporting that need. It does require a whole system change. on the island, we have been able to invest in the development of a multidisciplinary neurodiversity team. It's very small, it's in its very early stages. At the moment, it has the family support work function as part of it. What we're just looking at is how we bring the speech language therapy and the occupational therapy and the education psychology into that. All of those are slightly problematic on the island because those resources are not as accessible resource-wise. So it's not money, it's just physically having those resources. We have those teams set up in Portsmouth and in Southampton, and the island is following that same pathway and trajectory. We are working to engage with Parent Carer Forum, but as members might be aware, that forum is still very much in its infancy. In Portsmouth, in Hampshire and in Southampton, the Parent Carer Forum are right in the heart of developing and delivering that programme. They deliver training into schools and families. They are responsible for the design and delivery of how that pathway looks, and we'll be doing exactly the same thing here on the island as that Parent Carer Forum develops into a more mature kind of position to be able to help us do that. Doesn't prevent us from working with other parents and carers in other different places, but we'll work through that forum as our strategic partner to try and coordinate the input we have. And then the profiling tool, which is a part of the pathway, which allows schools and other organisations to understand the needs of children and young people, is currently being reviewed. And again, there is an ICB-wide review of that process, which colleagues from across different organisations and parent carers are involved in. And that's again drawing on national research and national best practice around how we can better develop that tool. The one that's being used at the moment is not as robust as we'd like it to be. But we are making really good progress on the island, and I think the council have been instrumental in helping move forward that process. There is definitely more to do, but I think we've made really good progress.
Thank you, Anthony. Thank you. Councillor Crichton.
On that, so you said about the Parent Care Forum. What is the sort of timescale on getting it set up over here? As you said, the others were in Southampton, Portsmouth, Hampshire, so that we've actually got it fully functioning and operational.
So they're up and running now. There is a core committee. They are meeting regularly with Ashley. I think Ashley has some regular meetings in with them. We have some plans in January to have a workshop to agree working relationships and a kind of a good transformative working environment with them. And the hope is from there we'll be able to agree a work programme with them and move forward with that. That isn't stopping the development work we're doing. We're finding other ways of engaging parents in the work we're doing while we're waiting for the forum. So it hasn't halted or delayed the work that we're doing, but it makes it a little bit more complicated because there are lots of other groups to engage with as we don't have a central coordination.
Councillor Gladwin.
Yeah, I was just wondering where it's not set up as you would like it on the island, are families actually able to access the facilities in Portsmouth or Southampton?
Very good question. No, it's not something we've looked at doing. The online resources and the support that's available through the online ND web portal is absolutely available, and there's lots of rich information on the Portsmouth website that we have made available here. But no, the broader speech and language therapy, occupational therapy isn't currently available from the mainland. But I have to say, I don't know that I'd completely reviewed that. So I'm happy to go away and have a chat with the team about whether we might support doing that.
Thank you.
Just to summarise, Anthony, thank you. It's what this has shown me is that we have not got a scrutiny function as a committee. But we can invite someone with a specific agenda. The agenda was the letter we sent that never got answered by your up the line. But if we invite someone to our meeting with a specific agenda to talk on, that is the way we can be more informed, if you like, as to what's going on. Things that you said that parent care forum is something that yes, we do need to develop. It's part of our structure anyway. But I like the fact that you said confident a few times, and you're confident to do this, confident to do that. We're better than others, but still more to do. But the biggest thing for me is the fact that you are part of the team here. I never realised that until we first met a few weeks ago. You're in the building. You and Kay and Ashley and the team work very closely together, so you are part of our team. So there's not that council. ICB, it's all joined up for the good of the young people. And I think that's a real positive. And clearly the questions we asked with straight answers, things are progressing, and gives us the confidence as a committee, hopefully, to know that things are progressing. Are there any final questions on what Anthony's just said? I think all our questions have been answered. I'm not sending any more letters to the ICB yet, not yet. But are there any more final questions or comments from Kay or Ashley would like to make? Ashley?
I'll make a comment, just to reiterate what you just said. We talk a lot about being one island team, and absolutely Anthony and colleagues like Emma Meek, who's appeared actually at scrutiny before, they've got passes for the council, they come and sit within the teams. We are one island team, regardless of which organisation we work for. So that's really welcome. And yeah, we're all part of the same team.
I would echo that. I think we work very closely as one team. I think it's our ambition to resolve the situation for children on the island. I think that's definitely our ambition. There are blockages, as we've heard tonight, but I am confident that, Anthony takes that seriously and tries to do all that he can to remove those barriers.
I do like that confident word. It's been used quite a lot. So that I think, that's, instead of being hopeful, and the confident word is important. And I think regarding what you said about, updates, could that be part of our performance quarterly update? Could a little line, and could come in there as to how we're doing on those issues? Because we can't say you must do this by this date, but every time we have a performance update meeting, anything you want to add, any progress that we've made would be useful to add into that report. So if there's no more questions, I'll just thank you very much for what you're doing, and thanks for coming this evening and talking to the committee as opposed to being scrutinised. Okay. Now, I know you're going to stay for a bit more of the meeting before you leave anyway, but I'm going to change the agenda around a bit, as I'd like to do. I'm going to bring forward 8D, which is the Isle of Wight Partnership, Children's Partnership Annual Report, because Scott's online. I know double act with Ashley. Hi, Scott. Good evening.
Good evening. Hope you can hear me okay.
Yeah, so I'll pass over to Ashley to and you to take us through 7D on the 8D on the agenda.
Thank you, Chair. I'm going to speak briefly, and then Scott's going to be giving you the main bit of information. So this is the annual report for the Isle of Wight Safeguarding Children's Partnership for 24-25. So essentially it covers the period from April 2024 to March 2025. You'll be aware that the agencies that are responsible for leading the Safeguarding Children's Partnership are the local authority, the police and the NHS, but of course it involves a whole range of other organisations as well. And we're extremely grateful for the work that our independent scrutineer does. We talk a lot about developing the culture of working, not just with NHS colleagues, but with colleagues across the system. And we want a culture where people feel psychologically safe to challenge each other in the best interests of children and young people. And essentially that's what Scott does. And I want to just say a massive thank you to him, because over the past 2 years, there has been a huge amount of change on the island, and managing risk relating to children, young people and families through a period of great change is really, really important. And I've been grateful to have Scott as a constant throughout that period, checking what we're doing, challenging us and driving high standards in everything that we do towards safeguarding children and young people. You've got the report in front of you. I'd like to just draw your attention to one typo in the report, which is on page 7, when it says that the total number of looked after children in 2024-25 was 367. It wasn't, it was 267. So what you'll see is actually the numbers of children that we care for in the local authority has been decreasing to a small amount over those years, not increasing massively in 24-25. So the 367 should be 267. But with that, I'll hand over to Scott, who's going to take you through some of the highlights of the year. Thank you.
And that's just a big build up, Scott. So the floor's yours. You're on mute, Scott. Scott, you're muted.
Yeah, someone else muted me, I think. I hopefully can hear me now.
Yeah, loud and clear, Scott. Yeah.
Yeah. Okay. Yeah. So yeah, big build up. Thanks for that, Ashley. And but first of all, so I introduced myself as an independent scrutineer. As you see in the report, I started off as the chair of the partnership and scrutineer, but that then passed over to Ashley taking over as the chair following legislative changes under Working Together, which is one of the main sort of what is the main thread of legislation that passes through the work that safeguarding partnerships do. So I'm also the scrutineer for Hampshire, Portsmouth and Southampton. So and you'll see that referenced in page 9. So that provides an opportunity for me to bring cohesion and share learning and practice across all 4 areas, alongside our partners in ICB, police and so other health partners who cover all those areas as well. The structure of our partnership is contained at page 13, so it's a mature partnership, I would say. I like the use of the word confidence, and I think I can confidently say that we are a mature partnership with good governance arrangements in place, but we always continue to test those governance arrangements as a partnership, but also with some of the questions I ask of senior members. This report is it's called a yearly report. It's one of our statutory responsibilities, and the safeguarding partners must jointly report on the activity that we've undertaken over the last 12-month period. And you see it's quite an extensive report that's been completed by the partnership team. The report's got to focus on the multi-agency priorities, the learning, the impact, the evidence and the improvement that we're making for children and families across the island. It details what the partnerships have done as a result of the arrangements, how effective these arrangements have been in practice, and there's a few bits that I'll sort of pick out. You'll see the contribution of each of the safeguarding partners have made, and the structure that's created to make that happen. It also outlines probably what Ashley spoke about earlier, but which I support a lot of, is the methods of scrutiny that we give the partnership. That includes the data, reports, questions that are raised in response to audits or review activity. Many of the audits we do, or all the audits we do, in fact, are multi-agency. We also do a Section 11 audit of our schools. The schools have to do an effective self-assessment of their own safeguarding arrangements, which comes into our partnership. So the evidence of those sort of audits, reviews, self-assessments are contained within the report. And in particular, we also analyse what's going on nationally. So there's a lot of national reports come out. So there's a Child Safeguarding Practice Review Panel who produce national reports. You'll see one around elective home education and safeguarding, and the report, the Practice Review Panel, I wanted them all to notice, which was the national panel review last year, which had a particular focus on sort of demographics and background. And the ways in which safeguarding partners have sought and utilised feedback from children and families, and I hope you've noticed that the link at page 2 provided by the Youth Justice Service, and that continues to be one of our priorities as a partnership as to how we engage with children and families. Evidence of how the safeguarding partners ensuring adequate representation and input of education has been really important for us, both at an operational in terms of our subgroups, but also at strategic levels. And that's something that we're really keen to continue to expand. And nationally, I think we may see some movement towards that in the next iteration of Working Together to Safeguard Children, where education should have an even stronger voice at our partnerships. One of the things that I would say the island should pride itself on is the extensive multi-agency learning offer that we give to our multi-agency workforce around safeguarding. But that's also supported by this year, during this reporting period, we had 3 practice weeks focused on neglect, children and victims of domestic abuse, and the learning we get from reviews. So that learning from reviews is really important that we distill down into the workforce. I also meet regularly, part of my role is scrutiny, but also I'm a critical friend to the partnership and to the senior leaders in the partnership. So I meet regularly with the senior leaders. They're called delegated safeguarding partners. So Ashley being one as the officer of the council, but also a delegated safeguarding partner. And also with the lead safeguarding partners, so I regularly meet with the chief executive of the council, but also the ICB chief nurse. There's a new chief constable obviously in place, and I will be meeting with him soon also. I suppose getting into some of the detail, and some views. It's been an important year, this reporting period for the partnership, particularly in relation to changes within health, with the formation. I heard Anthony refer to earlier about the fusion, the creation of that Hampshire and Isle of Wight NHS Foundation Trust, and I hope I've got that right, as one health provider across the 4 local authority areas, but also in particular around Ireland. Also the sort of the partnership between the St Mary's and QA Hospital in Portsmouth. But also in particular, you know, as a statutory lead for safeguarding children, the formation of the new directorate on the island. And then following on from that later in the year has been right at the end of this reporting period, but it's continued now, is the transferring of the multi-agency safeguarding hub back onto the island. It's something that the executive of the partnership and myself are wanting to be really close to, both in terms of that transfer of or the amalgamation of health resources, but also the transfer of the new directorate on the island and MASH back in February of this year. I suppose my role there is to continue to provide that sufficient scrutiny, as Ashley sort of alluded to, around that safe system that we should have on the island, and ensure the partnership is accountable for that safe system. So I've been seeking assurance along the way and been involved in many of the set-up meetings and governance that has delivered that. It's a key priority for me and the wider partnership, I have to say, in installing a culture where I observed the maturity of that partnership and providing support to each other as partners, but also that clarification and challenge where it's required. That clarification, challenge and support are all essential, in my view, to deliver an effective partnership. So you'll see actually at the inception of the MASH in February 2025 was quite I would say a fundamental change in how the safeguarding system has operated. But that transfer back from Hampshire, due to the sort of governance and planning, worked really well and felt seamless. I'm sure maybe it wasn't for a lot of operational staff, but it felt seamless in terms of and the buy-in, I have to say, across the island from not just the statutory partners, but the wider partners, particularly in education and health, was really strong. And you can see that. And next year you'll see about an audit I led in the summer, but also a staff survey which showed some real sort of strengths sort of shining through around the creation of our own front door arrangements, as they're called, for multi-agency safeguarding hubs on the island. And you'll see in page 6 of the report just a little bit of an indication of some of those contacts progressing to referrals, dropping slightly. And I would have to say in this reporting year, and you may have had this reported in data to yourself at other meetings, that has continued. One of our statutory duties is to review referrals made for children who have experienced serious harm. At times, I have to say, very sadly, passing away as a result of abuse and neglect. We follow a national process in Ireland, like all other safeguarding partnerships do. We've not had any formal reviews during this reporting period, but we have had cases referred, and that's very much part of that sort of audit and review cycle that we conduct through our learning and improvement group, actually chaired by Kay, who's in the room tonight. The impact of the partnership agencies that they have felt themselves has been represented at pages 36 to 44 of the report. And then dissemination of learning and embedding the work of the partnership, which is really important for us, is covered at pages 44 and 45, including some of the case studies that we've got involving former of our children. As we move forward, the voices of children and families is really key for us as a partnership. We now a standing agenda item in the meetings that we have at our main board, but also our executive and subgroups. Ashley's now volunteered to be the champion for that children's voice, and we're really looking to develop that in the coming year, as to make sure that we have those voices at the heart of what we do around safeguarding, because unfortunately that's often a time when children are in sort of, our children and families can be in crisis point. So looking ahead, I think you'll see at the end of the report the priorities that we have identified from an executive level, which will be delivered by the main board and the subgroups. One of those is the implementation of the Children's Wellbeing in Schools Bill, but also the Families First Partnership Programme. So we're setting up the governance around that at the moment, where family help will really be sort of delivered across the Highland. And that's the main things that I would pick out from the report. There's a lot of hard work has gone on across the island, both in terms of that transformation change, but also the delivery of a safeguarding system. And I would welcome any questions, Chair.
Scott, thank you very much for your presentation. We'll move straight to questions, I think. Questions? Oh, Councillor Andre.
Am I allowed a comment rather than a question?
You can ask anything you like.
I was really impressed by this report. I think it's an excellent report. There is so much in there. There were particular things I liked, the way it's actually laid out. But one of the things that really struck me about it is the honesty in the report. And for safeguarding, for me, that's absolutely key. Got an echo. Put that down. That might help. One of the things that is always at the top of my agenda is the voice of the child. And it was absolutely brilliant to not only see the voice of the child evident in the report, but to actually be able to hear it in that video. And really, really good to hear the children themselves praising the Youth Justice Service, who are doing some excellent work, but to actually be able to hear that was really, really good. Another one of the things that I really liked in it is the neglect strategy and the toolkit. So we're recognising those issues, but we're also working with partners to actually give them the tools to be more effective. And the final thing for me is, as you mentioned, is bringing the MASH in-house. Obviously, I was very much part of the moving back from Hampshire, and it's fair to say that the MASH was one of the last elements that we brought back, and there was a reason for that, because we absolutely had to get it right. And when I actually went round the MASH to see how it was being implemented within County Hall, I was really, really encouraged. So thank you. There's so much good in there. It's really good to see. And thanks for all the hard work to everyone involved.
Thank you, Councillor Andres. Very kind and appropriate words. More questions? Councillor Critchin, you make comment, because you can.
Just a quick comment. So I don't think we can. The importance of it is so that the multi-agency working and the partnerships. I don't think we can highlight that enough, really, and this does. So it's really good. I think that's the only way to kind of cover these areas, and it's really important. So thank you.
What I found interesting was obviously the comment around, the smooth transition from Hampshire to setting up the Isle of Wight team. If that's the outside perspective, I know there was a lot of issues with doing it, and I'm sure that Ashley would agree with that. But yeah, if it's seen as seamless from for your perspective, which is encouraging. Ashley.
Yeah, well, sorry, Ashley.
Delighted Scott thought it was seamless, partly because he was very involved in making sure it worked well. So thank you, Scott, for that. Can I just say two other things? Scott highlighted the quality of the multi-agency training and workforce development we have on the island, and lurking behind us is Sarah Teague, trying to stay out of the spotlight, but this is the work that she and her team lead on. And I'm really glad that Scott highlighted it, because we do have a really good workforce development offer. And because we need, partnerships, everyone, whether you work in the voluntary sector or schools or early years providers or whatever it is, we need all our colleagues across volunteers, paid staff, everyone to be well trained and aware, because it's safeguarding is everybody's business. The other thing I wanted just to say is that one of the focus areas for the coming months and years is around adopting a whole family approach. And I wanted to highlight that an example of the way that the Safeguarding Children's Partnership will be working more closely with the Safeguarding Adult Partnership is the conference, which is taking place on the 10th of February next year. It's called Every Voice Matters, a whole family lens on domestic abuse, and it's being organised jointly by the Adult and Children's Safeguarding Partnership. So that is an example of it, and I think as we go forward, we'll be doing more of that sort of work.
I've never heard Sarah lurking in it before, but it's covered. Anything you want to, Sarah? Anything you want to add to that?
Thank you, Chair. Just to say that the work is mostly done by Amanda Findon and Kelly Diamond and Laura Rice. So I wouldn't like to take credit for all of the work of the workforce development in the safeguarding partnerships, because they do an awful lot of work in that, and Sally Bloomfield. So
Yeah, thank you. Any other? Councillor Fuller.
Thank you, Chairman. Apologies for my lateness. Just wanted to ask about the model attendance policy. School attendance is something that certainly needs to be improved on the island, and it is one of our sort of like priorities to improve. What I'd like to know a little bit more about is how the model attendance policy has been established and what outcomes are we seeing from that policy. I'm talking about it during on page 27. And it's the third bullet point down.
Apologies, let me just look at that. It might be that Ashley may have to answer this question a bit to provide the detail around it.
I think Scott J refers to persistently or severely absent children, that the policy has been established. Yeah, as Councillor Fuller's pointed out.
Because it's one of our priorities, I think the concern that I have is that are we seeing improvements in our attendance within our schools? Because the evidence didn't really support that a few months ago, and I'd like to know that we are making the right steps and we're using that policy in a positive way to address the problem that there is with school attendance on the island, which is lower than in other parts of the country. Thank you.
Absolutely. Scott.
Yeah, no, that is a priority for us. The children not attending school is a priority for the partnership. And it continues to be this year as a partnership. And in fact, we're even talking about the strategy for the year after, and it will maintain. So in terms of the detail of the data, I'll have to sort of pass to Ashley. I don't have that on me at the moment, but in terms of that cohesive introduction of what that model attendance policy, the liaison and governance with our designated safeguarding leads, that I'm confident that is strong. But in terms of the actual impact that is making in terms of the numbers, I can't give you that detail now. I'd have to come back with the detail around that particular question.
Ashley, yeah.
So the model attendance policy, not all schools have to adopt it. So it's being promoted and rolled out. There's a huge amount of work going on around that. In fact, in one of the other reports this evening, which is the service update, and you'll have heard me talk before about some of the priorities we identify across the whole directorate and across the whole island as priority, and it is around children not attending school full time, including children who have low attendance, because we know that there's a big overlap between different needs in that groups. So, for example, if you have low attendance, if you have a special educational need or disability, then you are disproportionately overrepresented in that. And we know that children who have low attendance may be more likely to be involved in the youth justice service, for example. And particularly, let's say, for example, you're on a child protection plan and you have low school attendance, then that has additional risk as well. So we have developed a more joined up data set now. So we have one data set, which a colleague, Rachel Williams, who some of you will know, who's fantastic, who leads on this work, where we actually can now look in one place and we can see children who are feature in more than one of those areas, so that we can identify the children and work more practically with them, either directly or with the schools.
Councillor Churchman.
I'm a governor at Haylands Primary, over 300 children. And last week I had quite a long talk with our families officer. And it was really interesting because it's mainly the same families. It isn't some children come and go. it is nearly always the same families. And we discussed how we can get round this, etc. Of course, in my day, if you didn't go to school, the local authority would send round what we called a board officer, would knock on the door and say, why isn't your child at school? But we don't have that anymore, which is a shame. But to be practical about how we tackle it, I did say to him that part of the problem is when a child doesn't come to school, they lose contact with other children. When they do come back into school, they are very often isolated because they've lost that daily contact. So it isn't doing the children's mental health any good at all. You've got lazy parents who either can't get up themselves, etc., or they want to bring the child into school when it suits their work timetable. It is complicated, as said, different, but he did say that it is nearly always the same families that are like this. And I can't help thinking that somehow we've got to explain to parents the damage they're doing to their children's mental health. In that, because they're not at school, they lose contact with friends. When they do arrive, other children virtually ignore them because whether we like it or not, they form their own little gangs. I can remember when I was at school, there would be half a dozen of us who were always together, and there would be other groups like that. And I think we need to get that over to parents. I'm not sure how. I'm due to do a newsletter shortly, but could we do something like pointing out these problems on the school's newsletters? Because I know at Haylands we send out a weekly report. As I said, I think we've got to tackle it from sort of two angles. Thank you, Chair.
Thank you. Councillor Gladwin.
Well, I just thought that this report was very impressive, and obviously a lot of hard work has gone into it. But I was wondering what problem areas have been identified from it and what measures will be taken to address those problems. Thank you.
One for Scott, I think that one.
Yeah, sure. So I would say that I'm interested in a couple of comments here about school. I mean, I think children or challenges around children attending school, particularly those with special educational needs and disabilities, is one of the focus areas. And I actually see a paper later in the bundle about some of the action being taken by the local authority. I think having eyes on those children at school is really important in terms of their own emotional, social and health and well-being. I think we need to understand why our children are not at school. There can be genuine reasons, and then parents have to work with the families to ensure that child still has that active participation in their education, and schools will do that with them, supported by the education inclusion team. But there are unfortunate occasions, and one of the things I had about some of the challenges that I see in the year ahead is about the impact of parental influences on children. So that can be living with domestic abuse, living with parents who are suffering from mental health, alcohol or substance use, impact of childhood trauma on parents. These are some of the areas that are a challenge for many of our professionals working with families across the entirety of the public service, from police, health, social care. Often those parental factors, not only children not attending school, can cause neglect in our children. So that's why we still have that priority around finding ways upon which we can try to get our children in school. Because if you've got professionals seeing children in school, then that's a bonus. How we can educate our parents to not have neglectful households, or even cause their own children harm through educational neglect or health neglect. So I wish I had the magic answer to all those things, but what I can say is I see a professional workforce in Ireland that are seeking all the time to improve outcomes for children and families wherever they can, and working with colleagues in adult services, to try and impact on some of those parental factors that are influencing some of the sort of behaviours and neglectful behaviours towards our children.
Thank you, Scott. Do you have a follow-up question? Are we happy?
No, that's great, thank you.
Okay, do we have any further questions for Scott or for Ashley? Ashley's got a question for himself.
I've got a question for myself. I'd like to share, just to build on some of the quality of work that's going on the island. So an example of that, and to give you assurance that the quality of work is really high quality. So within Rachel Williams's team, another colleague called Dave Edmonds. So he is regarded as one of the national leads around education supervision orders, and he works with families where attendance is low. He has been featured in the Magistrates Monthly magazine as an expert on this, and he was recently invited to speak at a national conference attended by local authorities from across the country and the DFE to share our story regarding education supervision orders and how we adopt them on the island. And it's been featured, our practice on the island has been featured as part of the attendance toolkit for local authorities. And our practice has been highlighted in that document for others to adapt into their ways of working. So there's some really high quality work going on the island, which is now getting some national recognition, which is great.
I didn't know. Can you pass on our words of thanks to him from behalf of the committee? I wasn't aware of that either. So if you could say that. If there are no more questions, just sum up. Can I thank Ashley and for Scott for as Councillor Andre rightly said, for it's just the quality of this, the way it's written in an open and transparent way. It's as it is. It's not glossing it up to be anything that it isn't. So I think the honesty and the openness of this report is welcomed. So thank you to Ashley for chairing, and thank you to Scott for what you do. Scott, you're more than welcome to stay for the rest of the meeting if you want. If there's nothing on telly, but if you want to disappear, Scott, thanks for all you've done, and we'll talk soon.
I'll go off. Thank you very much. Thanks.
Okay, we'll get back to the agenda and we'll move on to number 7, the service performance and improvement for Q2 document circulated. Actually, do you want to introduce the document or do you want to move straight to questions? What do you want to do? Okay.
So this is the regular update. The data is all at the end of Q2. What I'd say about children is that the needs of children remain high. The needs of families remains high, which is why we're seeing the numbers we are, not just around numbers of child protection plans, for example, numbers of children that we care for remaining high, but also ongoing requests for needs assessments related to education healthcare plans. The priorities that we have as our directorate remain similar or the same as when we last presented this at the beginning of October. So we're implementing the education strategy, which has 5 promises that we've made for children. Children's social care, still development of homes for the children that we care for, and developing our social work workforce and implementing the social care reforms. And then the matters that span the whole directorate being a focus on early identification and intervention, contextual safeguarding, so that is risk outside the family home, and also children not attending school full time. The report also has an update on the financial situation. You're seeing that at the forecast at the moment, or the end of Q2, had the directorate overspending, and the areas of overspend are transport for children from home to school, the cost of paying for homes for children who we care for, and the third area of overspend is around the spend on agency social workers. So we currently have 79 permanent social workers. We have 22 agency social workers. That number of agency social workers is decreasing over time as we recruit, as colleagues qualify through the apprentice scheme, for example. That is our long-term plan, to increase the proportion of permanent social workers within our total social work workforce, but that is going to take some time to fully deliver. Happy to answer any questions.
It's the data set now we're used to seeing on a regular basis. So We should have our head around what it's telling us. Questions, anyone? Councillor Andre.
Thank you, Chair. There's an awful lot in here, obviously, but very, very useful stats coming through. It's interesting that you mentioned the rate of children subject to a protection plan, because that was one of the things that I'd actually picked out on. It's really good to hear what our priorities are and where we're putting resources, but what I'd like to know are, what are the key things that keep you awake at night?
Rude question, but of course you can. Any other questions? Well, actually, I'm going to rethink. Yeah, I think it's very fair. I mean, obviously, a lot going on at the same time. But do you want to do a written response to that question, or do you want to?
Could I just, sorry, I'll just say, you did mention about transport, but I think we are covering that in the agenda later, so I'll let you off that one.
I don't stay awake at night, but the things that I think, some of the things that have come up this evening in other bits are the challenge we have on the island about certain specialisms. So when Anthony was talking, he was talking about school nursing, for example, and we're talking about speech and language therapists. We could talk about educational psychologists. We could talk about social workers. The challenge on the island is it's different to being, in a mainland authority where the workforce is very mobile and that people can move around. It doesn't work like that on the island. That's why we've had to commission a third party to supply all our educational psychology advice to deliver our statutory duties for children who have a needs assessment. That's why we've got 22 agency social workers, and we're doing everything we can to grow the workforce. The speech and language therapy challenge is, and I was speaking to the colleague in the council who leads that speech and language therapy team. Even when there's money available, there aren't people to deliver it. So I think what we need to do as an island community is develop those career pathways so that we take the long-term view. And the best thing we can do is to invest in our island workforce, people who are committed to the island, who live here, who want to be here for the long term, and train them up. And we need to hold our nerve while we do that, because that might take us some years to get there. But we will get there. I'm confident that in years to come, we will have far fewer agency social workers, because we've got brilliant people on the island who care about children, young people and families who want to do it. But it takes 3 years to qualify to be a social worker. So that I think is our biggest challenge at the moment, along with the fact that a lot of things that are impacting families are really multifaceted. So the cost of living situation, that the housing challenges on the island, all these sorts of the quality of housing, for example, those sorts of things. But thank you for inquiring. I'm sleeping okay. Thank you.
I just have one question actually on the rate of exclusions for secondary schools. It's gone up from 16.81 to 26.9%. And I just thought that stood out as quite a high for secondary schools to be excluding. I know it could be one day or whatever. 26.9% of secondary exclusion of secondary schools was concerning to me. So page 12, page 20. Glasses. To page 23 of the report of the whole pack we're talking to here.
So you're right. It's higher than we would like it to be. So what we're also tracking when we look at suspensions is particular groups involved there. So for example, we look at overall suspensions, but also you can see there children who have special education needs and disabilities are on the SEN support register of a school, or children who have an education and healthcare plan. And this is another example of where lots of things are connected. So if we're seeing an escalation of need amongst a young person who has special educational needs and disabilities, and they're also being suspended, we need to be looking at why that is the case. What support can we provide to the school, or how can the school invest in their workforce development so that they can better meet the needs of that child, rather than that child ending up being not in school? Because we've already just been discussing that if that child is not in school, we then have additional safeguarding risk about what they are up to when they're not in school. So it's all connected, and that's one of the benefits of having data like this, because it allows us to target what we do. And of course, we can drill down into this data and we look at it by school, so we can see particular trends around schools and where it is. And then the resource we've had, so for example, people I've already mentioned this evening can go in and ask questions about that school and identify what support would help.
Thank you. Anyone? Catherine Gladwin.
Yes, I was just looking at page 22 and the Ofsted inspections for the secondary schools, which is sort of like 50% good or better, and the previous year 50%. But that's obviously a lot lower than the primary school at 81.08%. And I was just wondering why there's such a vast difference between the two and what can be done to address that. Thank you.
Beth, yeah. Ashley, Beth, whoever.
Well, I'll start and then Beth. So you're right. I mean, that is the fact, isn't it? So if we talk about secondary schools, so 50% good or better. So that was under the old inspection framework. So schools don't get inspected anymore under a single word judgment. But under the old framework, so 50% good or better, I mean that 50% requires improvement or below. They're actually, yeah. So that's it. So what we are doing, we now have our school improvement team in place. So Beth joined us at the beginning of this financial year, March time, and we now have our in-house school improvement team, and they are now actively working with schools on a targeted basis to support schools and challenge schools, so that we can work together as an island community to improve these outcomes. So going forward, the Ofsted mechanisms have changed, the framework's changed, it's changing again since they stopped the single word judgment. But I guess what I would also say is that inspection is not necessarily, well, it's not the only metric that we look at. We look at a lot of other metrics in terms of the difference that children are operating at between when they start at the school and when they end the school. So we look at the progress that they make over that time, and we compare that with the national average progress that a child might make, for example, between when they start secondary school and then the GCSE rates levels that they get. And we know, I don't think anyone on the island who cares about children and education on the island is comfortable with where we are. We're not. And that's why we come to work every day to improve outcomes for children. And now we have the team in the council working on this. I don't know if you want to give any more detail about what we're doing, Beth.
I think just to make the point with the secondary schools, that only 2 of the secondary schools are actually local authority. So actually for us as a school improvement team, it's working with trust leaders who are, and building relationships up with them so that we are able to be partners with them. And like I say, working with the DFE in order to support those schools to improve standards as a joined up partnership. And that work has really begun in terms of having those relationships. But actually, in terms of the local authority, we only have the 2 secondary schools that we're working really closely with to support that school improvement journey and working with those leaders.
But also remember, of course, there's only 6. So if one going from RI to good, we jump 17% straight away. There's only 6 of them. But with primaries, there's obviously more, and the number doesn't fluctuate as much. But I think the work is going on with the second, and the DFE do engage on their schools, but that they are responsible for 4 of the schools on the island at 6. So yeah. Do you have any further questions? I'll just say again, thank you for the data set. It's what we're using on a regular basis now. We just build in the bit next month from the report, what Anthony said earlier, just a couple of lines on what was said earlier. Then we'll get used to this format and keep going on that format. So if there's no more questions, okay, we will move on to the decision-making part of the meeting. So 8A is the expansion of the SEM places, pages 107, 130. So I believe Ashley is going to present that.
So this paper relates to the expansion of Lionheart School from 120 to 180 places from September 26. So we've already mentioned the education strategy that we have on the island, and there are 5 promises that make up that education strategy. And I'm just going to refer back to them actually, because I think it's really important to remind ourselves what they are. So the first one is about having really high aspirations. And the point I'd like to make here is it's high aspirations for all children, even children who have other things going on in their lives, which means that attending a mainstream school might not work for them at the time. We still need to be really aspirational for them. The second one is rich curricular experiences with meaningful pathways into adulthood. Again, if going to a mainstream school is not appropriate for you as an individual, then we as a local authority must be really ambitious for the provision that we are able to provide for them. The third one is high quality special educational needs and disabilities provision for children and young people. So if you have additional needs, a disability, whether that's supported by an education and healthcare plan or not, we must make sure that their experiences and their outcomes are as good as they are for all children. And the fourth one is around having a highly trained workforce, and the fifth one is about having a sustainable education infrastructure, one that we can fund on a sustainable basis from our dedicated schools grant, which at the moment is significantly overspending. So the expansion of Lionheart, many of you have visited Lionheart. It's a very high quality provision. It's undergone significant change over the past year. And you've been involved in decisions in the past about it expanding from 60 to 120. And in the use of the former site of Cowes Primary School for a second place for Lionheart to operate for children with different needs from the other site, which is in Newport. And this is about expanding that provision further from 120 to 180. So what you're being asked to consider is to support the expansion of Lionheart from 120 to 180 with additional places for children with complex high anxiety mental health needs being provided at the former Cowes Primary School site from 2026 and to support the publication of the public notice relating to that. In terms of the funding for this, the capital funding comes from capital that Department for Education gives to the council specifically for investing in what's called high needs provision, so children with higher needs, and the revenue funding for it on an ongoing basis comes from the high needs block of the dedicated schools grant. So this doesn't impact the council's general fund. It all comes from specific funding for education. Happy to take any questions.
Questions? Councillor Mosdale.
Thank you. And I think Lionheart is absolutely amazing, but I think because this is a public forum, it'd be really good just to explain at this point, if a young person goes to Lionheart, what are the wraparound support for that, for that young person, because we're talking high anxiety, mental health, we are talking some young children who are having suicidal thoughts and things like that. And I think it'd be really interesting in this forum for you just to explain how that one-to-one support within that unit is protecting those children, and how your services that we've talked about this evening are working together within that environment. Because otherwise people just look at this, that we're focusing on education, but actually a lot of this is keeping those children safe and actually trying to solve some of those high anxiety and mental health issues that they have. Is that okay?
Thank you for highlighting that, because a lot of these children do have, they live in complex lives. And one of the things I've been really encouraged by actually when I've seen the proposals that Lionheart, or the development of Lionheart, is that the breadth of professions that they are now recruiting. So they are recruiting people from health backgrounds in recognition of the fact that a lot of these children have quite complex health needs. Some of the children who attend Lionheart have an education and healthcare plan where it will state what their needs are and what support must be provided for that. A lot of that support will be health needs. It might be delivered by a third party, or going forward, it might be delivered by people from within the Lionheart workforce. But what matters for a child, I think, is they have a joined up offer. Because again, we were talking earlier, families don't really care who someone works for. They just want it to be a seamless one-stop shop for the support that they need. So it is a multi-agency workforce. Some of them work for Lionheart, some of them in the future probably won't. But again, it's about one island team, whichever organisation you work for.
Councillor Fuller.
Thank you. I'm a local member at the former Cows Primary School site, and I've been in touch with the head teacher or the head from Lionheart, and I'm really looking forward to go and see the provision that they're providing in Cows, which I'm really looking forward to. What I think, in the early days, there was a lot of concern about the school and how it fits within the community, but it's fitting in the community really, really well. And what I really would like to do as one of the local members is actually promote the work that they're doing, the provision they're doing, and why they are promoting that provision. Because you talk to a lot of residents and they don't seem to understand that we need to now have schools to focus on children with individual needs. And Lionheart are absolute exemplars at doing that work. But there is still a lot of misunderstanding about what Lionheart's doing. There's been some really good PR that's happened concerning Lionheart, but I'd like to have that opportunity. And I'm hoping when I meet the heads in a few weeks' time that I can be able to discuss that with because they're doing some absolutely fantastic things. And I think we need to be able to promote that, because for too long, this council haven't done enough to support children that have this special education needs and disabilities, and I think this is a step going in the right direction. It's not everything, but we're doing some great things, and I'd love to be able to have the opportunity to talk to you and the head outside the meeting to be able to see. We've got the consultations going to happen after this meeting about talking to the local community, but I'd like to be able to promote that as a ward member, because I think it is really important that this provision is there for the community of the Isle of Wight.
I think, Councillor Fuller, thank you. And Councillor Andre and I did a joint visit to Lionheart 6 weeks ago. I was absolutely blown away, to be honest. I went there when it was a pupil referral unit, when I was cabinet member, but you would not believe what the Lionheart school does. The image, the way it's done. Andrew has done such a brilliant job at the school. It's amazing. His links with some of the secondary schools are challenging, and that feeds into the exclusion bit from schools. He's a total inspiration, and he's a benefit to credit to the Isle of Wight that we've got him here, because I'm sure he'd welcome a visit from you, and he's promised Councillor Andre and I a visit to the new school when it's ready to be visited. I'll include you on that as well. We'll go together and see the new premises, then you can sell it locally. But please go and see him. It's awesome. It really, really is. And the wraparound provision is there because the experts he's got, other people on the mainland working with him. It's not about taking that child out of school for 12 weeks so the school don't have to deal with it. It's what they do and the plans that they set out for that child when they arrive at the school, and then hand them back to the normal school with a total action plan in place. It's really, really impressive. And, please go and see him. You want to?
Thank you. Yes, if I can just add to that, I think we absolutely know from the data, but also anecdotally, because it's what parents are telling us, that this is exactly the kind of provision that we need. We're being asked here to agree to publish the notice, and I absolutely agree with the recommendation. I think it's exactly the right thing that we should be doing for our island children and families. So I'm very much in support of the recommendation. Thank you, Chair.
Okay, so unless there's any more questions, we'll move to recommendation. Recommendation is that public notice be issued in accordance with section 19, subsection 1 of the Education and Inspection Act 2006, the expansion of the Lionheart School from 120 to 180 places, additional places for children with complex high anxiety mental health, non-EHCP section 19 children be provided at the former Cowes Primary School site in Cowes from September 2026. Councillor Andre has just proposed that. I'm very happy to second that, having been there. All those in favour? Unanimously. So yes, please, let's carry on and do that. But seriously, what you see there is totally amazing. So Paul, it's definitely worth a visit. Okay. Move on to 8B, which is a corporate parenting strategy review. Okay, Mark.
Yeah, that's me. Thank you, Chair. Okay, good evening. I'm hoping for your endorsement this evening for the carrying together a parenting and partnership strategy and the 6, we just had a discussion here about the 6 priorities. We actually prefer Ashley's promises, to be fair. So we might come away from this. It sounds much better. And it's right. So I'm going to presume that you've all had the opportunity to read the strategy. So I will just give a brief overview and invite you for questions after. The purpose of the strategy was to reaffirm the shared responsibility of the local authority and partners to act as a committee corporate parents for the children that we care for and our care experienced young people. And I hope that it reflects a collaborative approach to ensure every child feels supported, valued and prepared for a successful future. The strategy has been co-produced and developed with children and young people to ensure their voices have been listened to and to shape some of the priorities and actions for the strategy. And again, I hope that the strategy evidences this and their voice throughout. We undertook a number of workshops and activities with children over the summer, and some of the work that 2 of our participation workers, Lizzie and Lisa, have done a really great job in trying to capture that and some of their feelings around support that they need. Also, the name Caring Together, a Parenting in Partnership strategy was chosen by young people. And it's really to emphasise that this is a partnership about care and a partnership of growing up, rather than it being a purely corporate role. And I have to say we quite like that. As corporate is kind of too corporate. Actually, we are about parenting in partnership. Again, another good example is listening to children and young people about their views. As many of you know as well, the local authority recently took the step to recognise care experienced young people as a protected characteristic, and we feel the strategy is also an important step to honour that pledge and to improve life chances of the children we care for and those young people who have experienced care. The key endorsements, it's has been heard now, the supported by Parenting and Partnership Board, formerly our Corporate Parenting Board, who were in agreement with the strategy. It's also been endorsed by the police, health partners, and Councillor Jordan, the leader, has also recently endorsed it. Since the circulation of the document, you will find that not all signatures are on there, but I just would like to reassure you that health colleagues have identified someone, and Annie McDonald from the police is also really quite happy to put his signature and support it. So again, it does reflect a really multi-agency approach to corporate parenting and that wider partnership with our colleagues. The 6 strategic promises that the strategy has highlighted from listening to the voices of children and young people is for us to be promoting educational attainment and aspiration for our children we care for and care experienced young people. That is, again, some of the things we've spoken about here today for other children, our school attainment, the attendance, celebrating our successes of our children and young people, so continuing to support those young people that go to university and reducing the numbers of young people not in employment, education or training. Our second promise is enhancing health and well-being. This again does relate also to the physical health and things and fitness of our young people. But we want to ensure that all young people have access to good health support through their regular reviews, access to healthcare when needed, access to dentists. And a really big theme that come out that probably won't surprise people who've listened to children and young people is the support for mental health, the impact that has, obviously being cared for, and previous trauma and as well. So it'd be a really key part of the action plans is to look at how we better support our children and young people with their mental health. In Promise 3 was ensuring stable and nurturing homes. This is ensuring our cared for children have the opportunity to live in nurturing and loving homes, be that foster carers, extended family, or we're safe to do so to return to birth parents. Key to this is some of the work that's already ongoing with our sufficiency strategy to increase the numbers of foster carers for our children so they can remain on the island close to family, schools and their local networks. Promise 4 was fostering participation and voice. Hopefully we've started that on the right foot with the strategy about listening to children and young people, but we want to build upon the groups that we already have, a number of groups that we meet with young parents of care experienced young people, and a number of groups with our children that we care for. We want to build on those and actually shape many more of our services and the support that we give them. And we want to embed the kind of culture that you said we did type culture. You know, you tell us and we've listened and this is what we've done to improve things for you. Promise 5, we'll be preparing for adulthood and independent living. So this is about ensuring all children are supported and given the skills to eventually live alone into adulthood. They can manage finances, have self-care skills, able to look after themselves, understand what being a good neighbour and be able to participate in the wider community. Again, some of our carers are going to be key to this. So we're already looking at some of the training for our foster carers, our Next Steps team and social workers about how we can help skill our children and young people to become more independent young adults. And Promise 6 is open the doors of the family business, creating opportunities for our children and young people. We quite like this one. This is about us as an organisation, but also partners, about actually, we really want to consider these children and young people as our own and as a family. And if they are part of our family, then as a family, we can find many opportunities for our children and young people. And as a local authority and partners, there are many opportunities we feel that we can provide our cared for children and care experienced young people, whether that be access to training, work, apprenticeships, and also homes as well. Just to give you a quick update at the Parenting Partnership Board, we have started the action planning on these. So each action plan does have an elected member to take a lead on it, which we felt was really, really important. And we will work on those action plans over the coming weeks and months. But today I'm just after your endorsement and I'm happy to take any questions.
Thank you, Mark. And Kay and Mark, thank you for the work that's gone into this strategy and engaging with the young people as well. So questions? Councillor Andre.
Thank you, Chair. I'd just like to make one comment first. I couldn't find anywhere mentioned in the strategy the Parenting Partnership Board. Don't think it's actually mentioned in there. But other than that, we often see strategies come forward to committees that are refreshes. This is absolutely not a refresh. Under the amazing leadership of both yourself, Kay, and Mark, I have, in all the years I've sat on the board, I have never seen such energy in the room that you have brought. In fact, we have a bit of a problem now because we can't find a room that is big enough to actually fit all of the partners in, which is brilliant. The direction, the new direction that you are bringing here, the work that you are putting into it, that is absolutely with our children and families at the heart of it, is absolutely phenomenal. And it's really such a pleasure to be on the Parenting Partnership Board. And as you've highlighted, Mark, we do have the action plans. So obviously every strategy has to have its action plan sitting underneath it. But we have been tasked, we do have responsibilities, we will be driving it forward, but thank you for the clear direction that you're giving us.
Any more questions? Okay. Obviously, the last meeting we had was really good. We did put all the strategies together. Councillors that were there took a lead on the 6 strategy areas, the work that we did. And we did agree that we would be called Parenting and Partnership Board. There is a slight concern as to whether it needs to come to full council to be, because it changes the wording of the constitution. So that needs to be slightly looked into, but it has been agreed by the partnership. Parenting board, it's so long we call that partnership and parentship. Parenting and Partnership Board have agreed it, and I think as long as this council agrees it this evening, we'll just check whether it needs to go to full council just to ratify with the constitution. That we'll just check that one out, I think. I had a conversation with Kay and Mark earlier, and they'll liaise with you about whether that needs to come to full council just to be completely signed off for constitution purposes. Yes, Councillor Fuller.
Yeah, when I read the report, really happy. There's some really good positive things in there. One of the issues that we've always had on the island is that our children leave the island, they go on to do great things on the mainland, but sometimes midway through their courses, they come back to the island again. You know, there seems to be a magnet drawing young people back to the island, which is in a way is great. But I'm just wondering how we can better promote education on the mainland. It would be, you know, I know that there are a lot of young people that are taking courses now based on the island, and they keep staying on the island. But how are we developing our attainment for children in care to be able to make sure that they are carrying on to receive that extra support that they need when they leave the island? You know, certainly if they've had a difficult background, it's very difficult to be able to ensure that they can get that additional support. It's hard enough for young people anyway leaving the island to get that support. But what I'm looking at are children in care and how we can actually promote the care that the support that they get when they look to leave the island to get the necessary skills that we can promote on the island. Does that make sense? I know it's a bit garbled, but I think you're probably. I'm hoping that you're getting where I'm coming from.
Yeah, there's probably 2 bits to it. So if talk about our children that we care for, it's unfortunate if they have to move to the island, off the island. We like to keep them on the island where we can. However, if they do need to move, we work really closely with our virtual school to find the right schools for them in their local area that they may be living in. Their education, health and care plans also transfer with them as well to make sure that actually the support they get in schools would be what we expect on the island. So our virtual school is really key to that. So our virtual school head, Rosie Lister, and her team, they work really closely with the local authorities, and they're really good at searching for schools as well, and making sure that we find them the right schools. Your other part, I think, was probably more so about young people leaving the islands. If we're talking strictly care experience young people, they live all over, to be fair. We've got some in Scotland, north of England. Some of them are pretty independent, and we stay in touch. If they want to do college training within the area that they're living in, and then our personal advisors will work with them to find them opportunities. We have a number of care experienced young people that go to university as well, so we stay in touch with those and support them through that process as well, financially where we have to, but also ensure they have all the right and proper support for living away off the island, but also somewhere safe to come back home to as well when they're not actually at university. think that answered your questions. I was some of it, but
Sorry,
I'll have to come back.
I'm just so enthusiastic having read the report, and I'm thinking, I'm just, but I think you've answered it really well. You've answered the question a lot better than I asked it, but it's certainly really important, but important for the young people on the island to ensure that those safeguards and that safety net is there to support them in the future. Thank you.
Okay, thank you.
Okay, you want to add to that?
I just wanted to expand slightly because bring it back to the strategy, because if we deliver on all of those 6 promises within that strategy, then what we will do is we will skill and equip our children to be successful, to have recovered, to be able to follow their dreams and aspirations, so that any child who has the ambition to attend university or a school or college off island or on island will be able to support them to do that and equip them to do that as parents together.
Absolutely, Kay, and I think it's so important that that all children deserve the same opportunity on the island, no matter what their background is, and it's really positive to see that we're doing that, and we're trying to promote those opportunities that should be available to all children, regardless of what their backgrounds are. So thank you so much. And please pass on my thanks for taking this seriously. It is really positive. Thank you.
We've also got the apprenticeship board, which does help care experienced people, if they're suitable for a role, to get interviews. So they haven't got a separate board for care experienced people, but they do prioritise and focus on care experience looking for work on the island as well at the same time. So if there's no more questions, thank you for the report. And as chair of the Parenting and Partnership Board, I just want to move the recommendation that the committee approves the Isle of Wight Caring Together a Parenting and Partnership Strategy 2025-2028 to ensure the local authority continues to fulfil its statutory obligations. I look for a seconder, please. Councillor Andre seconds. All those in favour? Thank you. And we'll just clear up the issue around the Constitution a bit later on. Thank you. Okay, we'll move on to 8C, which is the commissioning of the new home to school bus contract and new taxi framework, which Ashley will be leading on.
Thank you, Chair. So this is an item for noting, and the reason it's here is to make sure you're aware of what is quite a significant service area within the directorate. Not just because there's a significant numbers of children who are being transported every day to school and back, but also because of the financial challenge that is associated with that. So the paper and the appendices give you more information about what's happening around the recommissioning of taxi provision and bus and coach provision. So the current contracts run out in August 2026. So next August, the end of this academic year, we need to have new arrangements in place for the beginning of the next academic year, September 26. And you can see the timelines in the appendices. But I wanted to share with you, what does this actually mean for children? So every day, the council arranges the transport for about 1,650 children. And I've broken them down into 4 different categories. So there are some children who have educational healthcare plans. So there are 131 children with educational healthcare plans that we transport to primary schools, 318 children with educational healthcare plans that we transfer to secondary schools. And then there are 105 primary school children being transported who don't necessarily, well, they don't have an educational healthcare plan, but they may have special education needs. And about 1,050 to secondary school. So that adds up to about 1,600. And then what we also use is when there are spare seats on those buses, we make them available to other people who aren't necessarily eligible, and they can access them as well. So it affects a lot of children, it affects a lot of families. Our spend on this in a year, this is mostly out of the council's general fund, a little bit comes out of the dedicated schools grant, but the council is spending about £5.5 million a year on home to school transport. Last financial year. This year it will be over 6 million. And the reason it's going up is twofold. First of all, the numbers of educational healthcare plans is going up. That means that we have a statutory duty to transport more children. And the second reason is that the costs of travel is increasing. You'll be aware what the inflation rate is, costs of labour, costs of transport, etc. And that means that the council is incurring more and more spend in order to deliver its statutory duties relating to this. We are also transporting children not just on buses, coaches and taxis, but we do also have alternative arrangements where parents receive money to take their children to school rather than us arrange the transport. We also have a small amount of we use council vehicles to take children as well. And as part of this process, what we've also started is a whole council working party to look at what is the total council spend on transport arrangements, and are there opportunities to use that economy of scale of combining home to school travel with everything else that we do. For example, sometimes we have to transport children around relating to children's social care, but adults are moving people around, and there are other transport things that the council does. And we've had that working party met for the first time in October. We met again at the beginning of this week, and there's some really exciting opportunities coming out of that about whether, for example, we should be expanding the council fleet because we'd be able to deliver services to our residents actually cheaper than we are currently commissioning from the private sector. So that's all work in progress, but it will feed into this process as it develops in the coming months. So it's really here for you to note that that's all going on, to make you aware of what a significant piece of work that is and a significant bit of service delivery that we have, but also around the financial pressures that is bringing to councils. So if you read about council financial situations around the country, you'll know that a lot of them are talking about the challenges around special education needs and disabilities, and more of them are now talking about the challenges around the transport budget as well, particularly for councils that have rural areas like we do on the island, where sometimes those distances can be quite big. Happy to take any questions.
Yeah, a couple of points I'll make. First of all, this is statutory. We wanted this statutory, and it's not means tested. We have got one bus company on the island which is a monopoly, which we can't break, unfortunately. But if you try and get a taxi on the island, I tried to book a taxi yesterday, picked me up at the end of Briar Pier at 20 to 4. The first two firms I phoned, all their taxis were out doing school business. I managed to get one in the end from a third phone call. But anyone on the island wants a normal taxi between 2:30 and 4 o'clock, forget it, because every taxi on the island is commissioned for the school run. So it is a real problem. It's good to hear that actions have been taken to, as a whole holistic approach from the council to look at this. But Councillor Mosdale.
Firstly, thanks. I would have come and picked you up if you'd messaged me. Clearly, you lost my number while you were away, because usually I'll message you to come and get me. So if we're looking at this over the future and and trying to resolve on a whole council thing, I need to put my rural councillor's hat on. There are areas, especially like Alveston, hasn't had a bus for years. Haven Street has spent a long time discussing, trying to get a bus route. I think if you involve someone like iWalk with this, that they'll find some of those rural areas that really desperately want some form of bus service. And actually, they're rural councils that do have some funds that they could put towards it. So you could actually approach those and have some match funding that says, we're going to run this service first thing in the morning, and we're going to run it at this time to bring these children back through. Yes, I understand safeguarding and everything, but if it was a normal sort of bus route, it could be looked at. But there are some real rural communities who are desperate to have some form of, transport, and would be interested, if you spoke to those councils, that would be really interested in seeing if there was anything they could do to be involved in it, for the residents of those areas as well as the children that live there.
Thank you, Councillor. That is actually one of the things we're looking at. So Stuart Chandler is leading on that. One of the places you mentioned actually was mentioned. So exactly that we could actually be funding things together and everyone would be better off. So that Stuart's leading on that work.
Got the example, of course, of the Fit bus, haven't you, in Freshwater, Yarmouth and Totland, that's partly funded by the parish councils. So, sorry. Follow-up question.
And it's not, it's another follow-up to add to it. So I didn't want to put them in the same sort of, but I know with my adult social care hat on that some of the larger care homes on the island do actually get involved with having their own minibuses and stuff like that that run regularly to different areas, and they would be interested to, you know, be involved in that communication as well. The amount of staff that move through care homes at the same sort of times that you are looking through to get children to school is another way of actually maybe encroaching it. So if you speak to the Island Healthcare Partnership, they do actually have a service that they run at the moment and would be always in, you know, open to actually discuss if that can be used as well. Just other ideas that you could put into the mix.
Councillor Fuller.
Yeah, I remember the good old days of when we used to have the white bus, which was the council operated bus scheme. And, you know, I think from white bus, when we lost white bus, which was the Isle of Wight Council's subsidised scheme, the Isle of Wight Community Bus Forum came up. And, you know, what we saw with the Isle of Wight Community Bus Forum is that you have a fleet of buses that we use for transport first thing in the morning, last thing in the afternoon. But what are they doing during the day? And there is a real opportunity there to be able to work with rural communities through organisations like IWALC. I've had discussions with IWALC about, you know, creating routes that go a lot along to these outlying areas. And I think Councillor Mosdell is absolutely spot on. You know, Haven Street is one area, quite a large village in the middle of nowhere, no bus. You know, you've got a growing elderly population where people have bus passes, but they don't have a bus that they can jump on. You know, other areas we have is Porchfield, huge, quite a large community, no bus service. So there is a real potential here to be able to sort of like think with our transport colleagues about improving, you know, services to our rural areas. And if that is in-house or whether it is in partnership with Southern Vectus or in partnership with somewhere like the Isle of Wight Community Bus Forum. And I've been talking to Ian Ward about the Community Bus Forum, about perhaps opportunities for the future. When we set up the Community Bus Forum 20 odd years ago, this was the aspiration that we had at that time. So it would be really nice to be able to move that forward. And I think it's really important with our special educational needs and disabled children that those buses can be revamped in such a way that they are accessible to not only those children but also to the older population, as you've alerted us to, Claire. So there is quite a lot of overlapping that we can take advantage of. So really look forward to those discussions, and I'd like to be involved if I can. Thank you.
Thank you, Councillor Fuller. Councillor Churchman.
I'm an ex-Londoner, and while I was in London, I ran a coach company. And I'm sorry, folks, it's all about bums on seats. The Isle of Wight has only got 142 total population. If you go to London, there's a bus every 5 minutes because of the enormous amount of people. We also have on the island one of the highest car ownerships in the country. We have a real problem with possibly Rachel Reeves in a couple of weeks' time. The 5 major bus companies in this country have written to the government, and that includes first our own Southern Vectis, which is Go Ahead, have written to the Chancellor and said that if she's not careful, there won't be any rural buses at all. We really have to take this on board. I originally, when Haven Street was in my ward, I did persuade Southern Vectis to run a bus through Haven Street, and we did have it for a couple of years. But what happened, it wasn't used. It was used by 2 or 3 people. That is, you cannot run a coach or a bus on the basis of 2 or 3 people every hour. I don't know if you have any idea about the cost of running a bus. They are colossal. The actual buying of the driver's hours, which are very well controlled, cost of fuel, the cost of maintenance, etc. As I said, our problem on the island is our small population. I have spoken to Southern Vectis in the past. I was lucky. I managed to get a route through Haylands back into Ryde, but only because it was such a good urban area that it was used, and it is still running. But I don't know what the solution is, and I'm sorry to have to point these facts out. But if the Chancellor does the wrong thing, Southern Vectis might even pack up and go off the island altogether. Thank you.
Councillor Mosdale.
Thank you. My understanding is that whatever happens, we have to get these children to school. So it isn't a question of our conversation earlier is how we can actually try and save that by embracing the fact that we have no choice. These children have to be got to school and we have to transport them. My question to you is, listening to you in the past, we were talking about some of our home to school transport was actually children that had to be educated on the mainland because we couldn't provide the provision on the island. I would be interested in how many of those children or how many of those we're doing so much in embracing and getting the right facilities and the right educational plans on the island and embracing those children. How much of that really big spend will be changed by getting the right plans and the right provisions on the island to educate those children rather than going to the mainland, of which part of that cost of transport is, isn't it? I believe.
So I don't have that exact breakdown, but I'm really grateful you raised that point because that is one of the additional benefits to expanding local specialist provision. Because not only do we have a statutory duty to get people to school, we also have a statutory duty to provide the right type of education place for them. So if that placement doesn't exist on the island, we have to pay for them to travel all the way to the mainland. We do have children who travel on a daily basis to the mainland because there is not an appropriate education placement on the island. And we also have children who have to travel so far onto the mainland that they then become residential, and then we have to pay for their residential costs as well. So part of what we believe will happen is as we expand our local specialist provision, there will be more children who will be able to have their needs met on the island within their own community, alongside they'll be able to go to school alongside their peers rather than having to go all the way to the mainland. And not only is that right for the child, but it also means that we will have to spend less on transport. So thank you for raising that great point.
Thank you. So just clarity on that, when you are putting in, when you're doing your budgets and you're looking at this, that residential place that you're paying for will actually be slotted in within the cost for home to school transport. That will be part of that cost. So if they're at a boarding school that they have to go to this specialist, that whole cost will be going into this home to school transport, I assume at the moment.
I've only got one question, actually. The consultation is still live until Monday, isn't it, I believe? 24th, isn't it? Have we had many, do we know, had many responses? Okay. But it's a statutory requirement. We have to do this anyway. It's good to hear that there isn't one solution. You're not going to get a new bus company coming in and undercutting Southern Vectis, which would be lovely. But equally, it's a combination of solutions as far as I see it, with using our own transport. And there's some minibuses around the island that aren't being used. I like the idea of community buses and this combination of problems. And if it's an Isle of Wight strategy being looked at, there's potential savings in the long term for doing that, isn't there? So if there's any more questions, we'll move to the recommendation, just that we note, Councillor Love will like this one, that the committee note the ongoing procurement activity for school transport services commencing September 2026, endorse the strategic approach being taken to recommission home to schools, taxi transport framework and the bus and coach contract. Proposal for that one, please, Councillor Crichton. Councillor Fuller seconds. All those in favour? Thank you very much for that one. Noted. We move on to 8E. Welcome, Rob. Long time no see. Welcome to the meeting.
Thank you, Chair.
Over to you, Rob.
Okay, so hopefully you've had a chance to read the paper, but I'm here to share with you the results of our recent Ofsted inspection from May and generally to provide an update about the Adult Community Learning Service. So within the report, I shared how the service is grant funded from the Department for Education, and we are required to support certain national priorities. Locally, within this, our priorities include delivering maths, English and digital skills qualifications, providing some adult careers advice, online short courses, some work with families, and programs that generally support confidence, well-being and mental health. Every year we support over 500 adults, and this includes over 130 gaining their basic essential skills qualifications. The adults we work with, 40% of them declare a special educational need or disability. And I saw some data comparing with other local authorities this morning, and that is, we are significantly higher than average. A third of the adults working with us have not achieved their equivalent of 5 GCSE qualifications previously. So we consider adult community learning to be a vital step on the ladder, developing self-confidence and supporting people to progress to further and higher education, friendships and employment. So the Ofsted inspection in May graded the service good overall. It also awarded us an outstanding grade for our behaviour and attitudes, for which our tutors and our learners can be rightly proud. Ofsted said that learners have exemplary attitudes to their learning. They are highly motivated and they work extremely hard. This contributes to most learners developing useful new knowledge, skills and behaviours and achieving their learning goals well. So within the inspection report, there was also some areas for us to develop or to continue to develop. One was ensuring that those who study in qualifications continue to meet or exceed national achievement rates. To help progress that further, we are now offering additional qualification routes for maths and English, as well as functional skills qualifications. People can take a vocational route which doesn't lead to exams. We've made improvements to our personal development curriculum. So this includes us promoting and signposting themes around health, safeguarding, mental well-being, careers and employment, as well as their actual course that they're studying. Similar to the personal development curriculum, we also needed to make some improvements to how we are implementing our responsibilities under the prevent duty. The inspectors commented that some learners they asked could not recall how to keep themselves safe from the risks of radicalisation and extremism. We have focused a lot on our prevent duty during induction processes, but we're now extending that throughout the calendar of the duration of a learner's experience with us, responding to topical news stories that come up all the time, and echoing the messages around run, hide and tell in terms of personal safety related to prevent. The final area for development was around challenges of recording what learners do after they've completed programs with us. This is a very difficult task right across the country. It requires a lot of administrative time to try and track individual people. And people do not necessarily follow a linear pathway, so they do not necessarily automatically, after leaving us, go into employment or to college or university. So we have developed some tracking postcards using QR codes, some nice artwork on the postcards to encourage people to put them on their fridge at home and reach out to us in the future when they have made a significant step forward. We also held annual award ceremonies, and the case studies that we produce from those are shared through social media to help inspire other people to take similar learning journeys. Also highlight in the report that adult community learning is grant funded, and we have seen an erosion of the levels of our funding since 2010. Since 2010, we have not had any inflationary increases to our grant, so it is quite significantly reduced. So over the years, we have reduced the services. We have prioritised providing essential adult skills qualifications. But within the next 2 years, we are really in quite difficult situation in terms of our budgets. So this is being monitored as a risk, but however, there are also opportunities potentially, especially around devolution agenda. The Adult Skills Fund is one of the key responsibilities that would be devolved to a mayoral combined authority. And we're also linking in with colleagues both in children's services and with the regeneration team in terms of looking at any investment support that may come around growth agendas. Happy to take any questions.
Rob, thank you for your report and congratulations on your brilliant Ofsted report and all the work that you've done for many years now.
Yeah.
So thank you for all of that. And to Sarah as well for the support I know she gives you and the whole team. So if you pass our thanks to the whole team, please, from us. Questions? Debbie, Councillor Andre.
I don't know if you heard, Rob, but the our chair of the Isle of Wight Council, in his chairman's announcements, did actually wax lyrical about the Adult Community Learning Awards, and I was also there myself. Well, as you know, I try and come every year, and it's an absolutely wonderful to see. It's the whole journey and how your service actually wraps around those individuals. So they're not just numbers or put on a course, or everyone that works in adult community learning really does everything they can to get those positive outcomes. But my question is, obviously, I've been well aware that funding has been an issue. I see from the report that funding levels have dropped. You can, you've got reserves maybe for a couple of years. Interestingly, you did mention that it is potentially one of the powers that could come under a mayor, and I'm amazed at what you're able to actually deliver with the funding that you have. But is there anything that we can do as a committee to actually help sort of lobby or raise awareness? As you said, it's funded from the DFE. So is there something we can do as a committee to raise awareness that actually this is incredibly valuable work that needs to be properly funded?
Yeah, thank you very much for your kind comments. Yeah, any opportunities you do have, if you are at DFE events, then just promoting what we do on the island would be great. I think the Multiply project, which is funded across England over the last 3 years, should be reporting in the spring term, and that was lots of additional money. We had about 60% extra budget for those 3 years, focusing on adult essential skills. And that approach that DFE enabled us to do, hopefully, when they have their reports published, will make them think about how they fund it again in the future. I think there's a danger of the DFE looking at adult community learning and thinking it's just about nice art and craft courses and wine tasting and languages, when particularly what we've done on the islands where we've had to focus, we are trying to get people to progress into college and university apprenticeships, improve their job prospects, support their families. So yeah, any opportunities to promote what we are actually achieving.
Can I actually make a recommendation,
You
Chair,
may.
that perhaps Chair writes a letter to the relevant person of the DFE on behalf of the committee to actually highlight exactly what you've said, Rob, that it's not just about the sort of peripherals. I mean, the work that you do is actually changing people's lives.
Yes. Who exactly?
Rob, are you able to give us a contact at the DFE? Yeah.
My question is going to be, have either of our MPs been across and seen you, Rob, to see what you do and taken an interest in what you do? Because it's something that they should be lobbying for, because the offering that you do is different than as you just said, adult community learning isn't about arts and crafts and all that sort of stuff. It's about, core learning to get people back into work. I wonder, I'll also write to our two MPs at the same time. I like writing to them.
Okay. Yes, and Councillor Richard Quigley, MP, has been involved in the skills agenda, but neither of the MPs have currently had the opportunity to visit. So I'd like to invite those.
I'll happily do that for you. If you give me the contact of the DFE, I'll also write to both our MPs, asking them to come and have the courtesy of visiting you as well, see what you do.
I'm happy to amend my recommendation, Chair.
Ashley.
Just briefly on it, when I went to the award ceremony the other evening that Rob organised, one of the things that I really learned was actually about how complementary this offer is to loads of other things that we're also trying to do. So, for example, if you're a young person with special educational needs and disabilities and you want to further your education, our statutory duties for children with young people with additional needs go up till they're 25 years old. So this is a really fantastic pathway for them to continue their vocational training and on their journey to become as independent as possible. And the other example we had there was a family who'd been on a parenting program, basically delivered via this service. And they were a family and they had a child who had additional needs, and they were receiving some excellent advice about how to support their child with additional needs. So it's all linked up to the wider agenda that we have. And it's part of that really valuable package of a range of support that we need for our residents.
It also links into the work that Bernardo's do. Whereas we've been met with parents got to give up work to look after their child and they want to retrain, etc., etc. The whole thing, it's all there if it's just linked up properly. It's all there, isn't it? Are there any more questions for Rob? Or letting you off lightly, are we? Okay, Rob, thanks again from the committee for what you do. Please pass those comments back. So the recommendation in the paper is that the committee note the report and recognise the achievements of the service, and the committee note the financial challenges faced by the service. I'll propose that, seconded by Councillor Andre. All those in favour? Great. Thank you, Rob, and thank you for coming to present your report this evening. Okay, we'll move on to the last item on the decision section. Is 8F is the complaints report, which is it for Kay? Over to you, Kay.
Thank you. So yes, I'll give you the headlines from the report. It was actually written by a colleague of mine, Victoria Clotty. So it's the Children's Directorate Annual Complaints Report for 2024 to 2025. You'll be aware that we have a statutory responsibility within the Children Act to make sure that we have a complaints process that's across children's services. So it includes children's social care, education, inclusion and access also. It's for noting tonight, Chair, and it's about you being able to assess our compliance within those statutory requirements, but also so that we can identify those learnings that we need to take forward as a service to improve our services for children and families on the island. So some of the headline findings, you will see that the total complaints and representations across children's services or children's social care, there have been 72 representations. 45 of those have been statutory complaints, which is up from 37 in the previous year. 22 of those were upheld and 23 not upheld, and there were 10 learning outcomes recorded from those complaints. In regards to education, inclusion and access, there were 87 complaints, which is a 107% increase from 42 the previous year. Upheld cases doubled from 12 to 35, reflecting that those were valid concerns that were presented. In regards to the Ombudsman, there were 20 referrals, 8 of those were upheld, 6 of which were education related, and 2 of those were children's social care. 100% compliance was achieved within those recommendations made. 89% of the statutory 1 complaints were responded to within 20 working days, which shows a strong response. albeit obviously there's 11% that weren't within those timeframes, but sometimes those would have been for purposeful reasons. Advocacy has proved to be really quite beneficial from people having advocacy quite early on, so that there's that early resolution. However, there are gaps that remain in advocacy for adult complaints. Barnardo's supported 3 children and 2 adults within those statutory complaints also. So I'll move on to some of the themes. So for children's social care, there's an ongoing theme in regards to poor conduct by social workers, of which that was 31 complaints. A lack of support related to 18, poor communication, 16 complaints, other issues such as inaccuracies or miscellaneous issues, there were 24. So what we did the previous year, because there were numerous requests to change a social worker. So during that year, there was a reclassification of those requests so that we could get to the root causes, which is what I've just outlined there. In regards to education and inclusion and access, it will be no surprise that a number of those increases have related to education healthcare plans for children, those children with special educational needs and disabilities. So where there's either a delay in those being processed or where there's a question mark around quality, that related to 40 complaints. Provision not being delivered was 18. And special educational needs service concerns were 10. Other themes that came out of those complaints were school transport related, school place planning related, or communication gaps for some of those also. So the complaints mirror national special educational needs and disabilities pressures, but also it captures those local capacity issues that we're experiencing within the service. Some of the learnings and outcomes. So for children's social care, as I've also already alluded to, there's some persistent issues in regards to social workers' conduct and communication that require both cultural and practice improvements that we're looking at working on. There's new complaints process in place now, which we're hoping will have an impact. So you'll be aware that we appointed to a local authority designated officer, so our LADO. So our LADO is also our complaints officer for children's social care. So we are confident that that's going to strengthen our governance and embed the learning from these complaints. In education, inclusion and access, in regards to those education healthcare plan delays and the gaps in provision, which we've actually talked about tonight in some regard, the area send improvement plan will obviously be looking at how they address some of those issues going forward. And also the increased engagement with the parent carer forum and SENDIAS to improve that transparency. We are sure will have an impact on next year's report. So in regards to the Ombudsman recommendations that were made through those complaints, they were about improved timeliness for EHCP processes and the annual reviews, strengthening communication and collaborative working across education, health and social care. So those are key priorities for us as a directorate. Some of the recommendations for 2025 and 26, which we're already working upon, is about improving that timeliness, as I've just referred to, also embedding learning across the service. So one of the examples I can give you there is you'll be aware that we recently appointed to a service manager for quality assurance in children's social care. And when that person comes into post on the 1st of February, one of the priorities will be to set up a quality assurance board in the local authority, which will include our complaints officers, the local authority designated officer, participation, auditing. So all areas where we're looking at a lens into the service, what we're doing well or not well, will be a board where we can then embed that learning, linking in with our learning and development colleagues also when it relates to training and development for staff. Enhanced communication engagement, that remains an ongoing issue for us and a priority, certainly as we're working very closely as one children's service. So Beth, myself and the new director are looking at how we can continue to improve communication across the service. You heard earlier an example around how we're working very closely with our virtual school for our children cared for. So again, that's a cross children's services provision. So I will pause there and invite any questions, as long as they're not too difficult.
Thank you. I know this is a statutory complaint paper every year, but so thanks for the level of detail. Lots of data there, lots of recommendations. Questions, comments, thoughts? Councillor Andre.
Thank you, Chair. It's interesting that you did highlight the 8 ombudsman cases, because I did note that we implemented all of the recommendations, and so we were in complete compliance with that, and no surprise of the high proportion that were related to educational health plans. I mean, that I would have been surprised if it hadn't been that way around, to be honest. We heard earlier that obviously workforce, I think this is a golden thread that actually runs through the council, the challenges as an island that we have with our workforce. I can't remember the exact numbers, but I think you said something like, was it 79 of our own and 22 agency, something like that. It might not be a metric that we actually capture, but obviously our agency social workers are, as much as we try to embed them into Team Isle of Wight, they are still agency. Do we know of those complaints that come in? Is there a higher proportion related to those agency workers rather than to our own in-house? And if so, what are we doing to address that?
I don't actually have the breakdown of that information, and we don't collate it in that way. So they would be complaints about social workers, so that would have to be a manual trawl. However, a number of those complaints do come to me once they've gone through that process for me to oversee. And what I can say is, regardless of whether it's an agency social worker or a permanently employed social worker, of which we value both because they're providing the right services for our children on the island. Communication can be an issue and it can be a theme. And, you know, there's some relating to conduct there, and that can be when parents are perhaps dissatisfied with services as well. So I think we've got some work to do, and certainly Sarah and I met quite recently to look at what support we need to put in place across the service for our social workers around, you know, professional boundaries, about how we improve communication, how we deliver difficult messages. So I think there's more that we can do to support social workers, and also hopefully prevent some of the complaints that we have. And also recently we employed a principal social worker, and a key role of that worker is to support the workforce, our social workers, to improve practice. So again, and this will also be linking with Sarah and her team, looking at how we support social workers in regards to reflection on the work that they do through, for example, action learning sets and groups that they can come together. So I am hopeful that from the learning of what we've seen through these complaints, we can address them in a range of ways.
Have a follow-up.
Of course you can, yeah.
I mean, I think we all appreciate what a challenging role it is. It is not an easy vocation really to do. So it's good to hear that there is support. I think for me, and I think it's what's happening here as well, is there needs to be that culture, the right culture that we can actually encourage social workers to reflect, because it's a difficult thing to do. But I think you've absolutely nailed it for me with that communication, because you can say the same thing, but you can say it in different ways and have a completely different outcome. So it's good to hear that you are supporting our social workers in that area.
Do you have any further questions? Councillor Churchman.
Yes, I mean, I can't imagine how difficult the job is, because you have a social worker knocking on the front door and basically, I'm simplifying it, they really don't know what to expect. And do we have a chart, or do you have talks about where you have really difficult families, where the social worker really struggles to deal with the family concerned? And also one has to remember that you and I, we might like one another, but I might like somebody else, but you might not. So do you sometimes, or do you ever swap social workers away from perhaps one family because there are problems? But do you record any of the social workers' comments about what I would call difficult or irrational families? Thank you.
First of all, thank you for acknowledging that the role of a social worker can be quite difficult and challenging. It certainly can be. They do excellent work to support our children and families in really difficult circumstances, and quite often without the recognition of that. So thank you. I'm very grateful, and I will share that back with our staff to let them know that you've recognised that. In regards to support, so again, there's a range of support that our social workers have. So as you heard earlier, social workers, it's a 3-year process to qualify as a social worker. So a lot of the work through that is around communicating with families, managing difficult situations, dealing with hostility and so forth, and how you overcome those barriers to be able to support that child in their protection and safety. So there's a lot of work through the training, but it doesn't stop there. So thereafter, there's continuing professional development that we have to do as qualified social workers. So we have to demonstrate to our registering body every year what we're doing to continue to develop and progress as social workers. As I've said, we also have quite a comprehensive training package. You heard also from our Safeguarding Children's Partnership, the multi-agency training package that's available to us. So there's a lot of training for social workers. When we learn about particular issues or the themes or patterns, then we'll try to identify the right training for social workers to address that. And then in regards to dealing with individual difficult families, our social workers have what we call reflective supervision, and that takes place monthly. So they will have reflective supervision with their line manager, where they have an opportunity to talk about impact on self, but also about any issues or difficulties that they might find challenging. And if that doesn't resolve the issue, then we can look at further support for those social workers in that circumstance. And then finally, I think your final point was about, do we, if there are issues or difficulties for a particular social worker with a family, would we change that social worker? What I would say is, in those circumstances, we would try to minimise changes of social workers for children and families, because what we do know is there can sometimes be conflict or difficulty. So first of all, we try to resolve that and see if we can work with the family with a consistent social worker. But there are those occasions where sometimes we do have to make changes, and that might be because it's a request of a child or request of a family where we can't move beyond what those potential difficulties are, but we try to keep that to a minimum, because we know that changing social workers for children is not always in their best interest.
May I ask one other question? When a social worker is appointed to a family, do they just knock on the door and say, I'm your social worker? Or do you go with, say, the manager and the social worker, and the manager, for example, says, Mrs. Critchison, I would like to introduce so-and-so, this is your social worker. Is that an approach that you use?
It's not often that a team manager would go to see a family with a social worker. So social workers are skilled and trained to make those initial introductions. So it may be for the first time contact with a family, we might do that via a telephone call initially and arrange a time to go and visit. However, there are times when we just go and knock on doors. but social workers are, that's what we are trained to be able to do, to be able to make that initial contact with a family.
Would I say quite a daunting prospect at times?
Absolutely.
Do you have any further questions? Okay, thank you for this. So the recommendation is that the committee receive and note the annual complaints report for 2024, 2025. I'll propose we do that. Councillor Andre will second it, and all those in favour, duly noted. Thank you very much. Okay, nearly there. Well, before we do the work plan, can I just confirm all councillors are coming to the meeting on Tuesday morning? First of all, I know Councillor Andre isn't, Claire will be there. Paul, Councillor, are you around for Tuesday morning?
I have a few family issues at the moment that I'm needing to resolve, so I can't guarantee anything at the moment.
Councillor Christian, Councillor Glavin, are you here when Tuesday morning?
Yeah, no, the meeting, this is the meeting with all head teachers.
Yeah.
Yeah, the meeting invited coincided with another appointment I've got that I can't change. It's a medical appointment, so I might be able to attend the first half an hour or so. But
you're coming, Councillor Hendry.
But it was such short notice, Chair, and I understand you're working with head teachers, and it is a bit of a thankless.
It sounds like we've got at least 6. I'll reach out to Councillor Love and Councillor Lilly.
Thank you.
If you, yeah, just to clarify, this is our meeting effectively. Although officers will be with us, this is our meeting to hear what heads want to say about a variety of topics, mainly place planning and driving up standards, and really creating a system approach. It isn't them and us do everything. It's about, it's not our job to set standards, and it's what, it's to get everyone on board on the same page. And over 30 head teachers have actually said they're coming. So, which is really encouraging. It'll be in the chamber, and the plan, the initial sketch is that we will just do a bit of introduction, what we're here for, and then we'll break out into groups, set them a little task, break out into groups, what accounts are sitting with each group, and getting to come up with sort of 5 key actions, just like we did with the governor. So those who attended the governor briefing on school place planning, we're going to keep it a little bit more simpler than loading out of flip charts. We'll come up with 5 key actions to put a strategy together on how we're going to work together. It will include place planning, it will include school closures, but it will include driving up standards as well. So if we're going to do that, and over 30 said they're coming, which is encouraging, and more actually kindly sent out a chaser to some that hadn't replied. So yeah, so it's going to be at least 6 of us here at least. Or if you're available.
Sorry, Chair. Yeah, it's important to be there face to face, but again, I think that because of the short notice, the invitation came in, I think earlier on this week.
No, the intro came out about 5 weeks ago, 6 weeks ago.
Oh, I think it was probably the chaser that I've got.
Ashley chased some head teachers just to make sure the meeting was set up probably 6 weeks ago. So it's been in everyone's diary for at least 6 weeks, because yeah, but that's fine. And Ashley just chased some heads hadn't responded. We were copied into a chaser to the heads, but we've had good turnout heads, good turnout of the committee. Good, and I'll reach out to Councillor Love and Councillor Lilly and make sure they're coming as well. So looking at the work plan, we've got quite a lot. We covered everything off on our work plan for November. We've got quite a lot coming up in January. Are we happy? Nothing you want to add or take off? Ashley, you're happy with the list? Just a reminder to the councillors, we will be having a report on who has or hasn't done the 7 training modules that we all agreed to do by the January meeting. One person's done all 7. I like to lead by example. So there will be a report naming and shaming ones that haven't done the training in January. So they are really good. For what it's worth, they are really good training modules. I'm always sceptical, but they are really good training modules. Probably take you about 5 or 6 hours to do the whole lot, but less than that, about 5 hours, but it's well worth doing. I know Councillor Andre's done most of them. At Richmond started, I believe, haven't you? So yeah, there will be a report coming. So if you don't want to be named and shamed, get them done by, we all committed to do it by January. Let's not let's do it by January. Everything else on the list, I think we'll have no papers. Okay. Nothing else to add on for January? Okay. In that case then, at 17:44, we will close the meeting. Thanks everyone, and I'll see you all on Tuesday.